मॉर्निंग सर।
गुड मॉर्निंग मैडम।
हिमांशु सर, गुड मॉर्निंग मैडम।
कैसे मैम?
कैसे मैम? तैयारी चल रही
आ गए रेनू मैडम? मॉर्निंग रेनू मैडम।
Good morning, sir. Good morning, madam.
है।
Good morning, ma'am. Good morning, sir.
मॉर्निंग सोना।
Can we start? Can we start? Can we start, sir?
यस मैम वी कैन।
Can we start, sir?
वी कैन मैम वी
Yeah,
कैन
yeah,
स्टार्ट।
yes, ma'am. We can start. Yeah. Hmm.
Good morning, everyone. Jai Swaminarayan. A very warm welcome to all the esteemed evaluators, respected faculty members, research scholars, nursing professionals, students, and all the participants who have joined us through the Zoom platform for today's scientific paper presentation. May I request everyone to kindly keep your microphones on mute and switch off your video when you are not presenting. We also request you to keep your display name appropriate for identification and avoid interruptions during the presentation. We shall be commencing the program very shortly. I request everyone to kindly remain connected with us.
Settings actually I can hear. Sure. I can hear without.
So we are going to start our today's scientific paper presentation. Give me immense pleasure and privilege to welcome you all to this academic gathering on the occasion of scientific paper presentation, which is being organized by Vibrant Nursing College, Surat. Scientific paper presentations provide an excellent opportunity for researchers, nursing professionals, and students to share their research findings, innovative ideas, experiences, and evidence-based practices. As we know, research is the foundation upon which progress in nursing and healthcare is built. Today, we look forward to an enriching exchange of ideas, knowledge, and experiences. Now, we come to one of the most important part of today's scientific paper presentation, the introduction of our esteemed evaluators. The quality of any scientific presentation enriched by constructive evaluation, expert guidance, and valuable feedback. We are truly privileged to have with us distinguished experts who have graciously agreed to evaluate the presentation and share their valuable insights with our participants. Now, it is my proud privilege to introduce our first evaluator, Professor Himanshu Trivedi, sir. Sir is a principal of Panchamrit Institute of Nursing, Nicole, Ahmedabad. The previous prestigious positions held, Sir is currently working as a principal at Panchamrit Institute of Nursing, Nicole, Ahmedabad. Sir was a principal at Dr. Subhas Nursing Institute, Junagadh, principal at Santiniketan Nursing College, Padusma, and Sahjanand College of Nursing, Jundal, Gandhinagar. and also as a lecturer at Sahajanand College of Nursing, Junda, vice principal at Diomogra School of Nursing, assistant lecturer at Spurti College of Nursing, Bangalore, and clinical experience at Apollo International Hospital, Ahmedabad. Qualification. Sir has completed BSc Nursing, MSc Nursing with Pediatric Nursing, and PhD Scholar in Nursing. Sir is pursuing PhD Nursing. Awards and accolades. Presidential Award and Best Services in Bharat Scout and Guide has awarded by Honorable President Dr. Shankar Dayal Sharma. Silver rank, second rank at in MSc Nursing from Vinayaka Mission University, Salem at 2009. Talking about research and publication, scientific paper evaluator in 5th National Conference Nursing Nexus 2026. Sir has published research articles in national and international journals, also published research on helper skin tap technique, guided imagery, therapy, and generative AI in nursing education. Sir is an author in nursing research, a textbook of nursing research and statistics for BSc nursing students. Sir is also author in a quick review series, first year GNM Fundamentals of Nursing. Sir has published 3 patents in healthcare technology and innovation and research projects undertaken in pediatric nursing, nursing education, patient care, and health promotion. Other special mention, resource person at state, national, and international conferences, editorial board member in International Journal of Innovative Scientific Research and Education. Sir is a lifetime member of TNAI, NTAI, Nursing Scholar Society, and Nursing Honor Society. Sir is a chairperson at National Conference on Nursing Education and Practice. And sir is an experienced research guide, academic leader, and nursing educator. So, next, our evaluator is Professor Reenu Matthew, ma'am. Madam is currently working as a principal at SRE Institute of Nursing and Allied Health Sciences, Ahmedabad. So previous prestigious positions held, currently working as a principal at SRE Institute of Nursing and Allied Sciences, Ahmedabad. Madam was an assistant professor at Sri Sahajanand Institute of Nursing, Bhavnagar, lecturer at Sri Institute of Nursing and Allied Science, Ahmedabad, nursing tutor at Sumandeep Nursing College, Vadodara, and extensive experiences in nursing education, academic administration, faculty development, and curriculum planning. Madam has completed BSc Nursing from Government College of Nursing, Jinera, Ahmedabad, and Madam was a gold medalist at Gujarat University in her BSc Nursing program. Then MSc Nursing in Medical Surgical Nursing with super specialty CVTS, and Madam is currently pursuing PhD Nursing from PP Savani University. Talking about research and publications, Madam has published 22 research papers in areas of nursing education, AI in nursing, clinical practice and patient safety, community and public health, nursing education, and professional development. Research interest includes artificial intelligence in nursing pedagogy, evidence-based practice, and community health. Presented scientific paper at Second National Conference, KD Institute of Nursing Sciences, Ahmedabad, and intellectual properties, UK registered design, AI-driven self-sanitizing medical nursing workstation. Other special mention as an evaluator in scientific poster presentation, Nursing Con 2025, as a judge, Kalpbrooks 2024, Nursing Nexus, as a chairperson in scientific sessions at state and national conferences, and as a moderator, Nursing Con 2026. As an examiner for various universities and subject expert for faculty recruitment, Gujarat Nursing Council inspector also, as a section editor, the Voxy Journal of Medical Science, and as a certified peer reviewer at Elsewhere Researcher Academic. So, once again, a very warm welcome to our esteemed evaluators. Thank you for being with us. Now, we are moving towards the most important academic segment, the scientific paper presentation. The scientific paper presentation is not merely an opportunity to present research findings. It is a platform to communicate evidence, stimulate critical thinking, encourage innovation, and contribute towards improving nursing practice and patient care. Today, our presenters will share their research work with us, highlighting their research problem, methodology, findings, conclusion, and implications for nursing practice, education, administration, and research. I am sure today's presentation will provide us with valuable insights and inspire us to continue our journey towards evidence-based nursing practice. Before we begin, I request all the presenters to kindly keep your microphone muted until their name is announced. So, without taking much of your time, let us begin today's scientific session. It is now time to invite our first presenter. So, the paper will be presented by Miss Mitali Ashokbhai Painter. So, I request Miss Mitali to begin your presentation, and I request all dear participants to kindly give your full attention to the presentation. Over to you, Miss Mitali
Hello.
Painter.
Thank you, ma'am. Good morning, everyone. No, a very good morning to one and all. I am Mitali, research scholar at Vidyadeep University. Here, the problem of statement of my study is a study to assess the effectiveness of beetroot juice in lowering the blood pressure among pre-hypertensive individuals in selected areas of Surat. Objectives were to assess the blood pressure among the pre-hypertensive individual. Second, to evaluate the effectiveness of beetroot juice in lowering of blood pressure level. Third, to find out the association between the blood pressure level with the selected socio-demographic variables. Uh, as an introduction, hypertension, we all know it is a major problem, health issues worldwide, and if it is a persistent elevation into the blood pressure, it may increase the risk of the cardiovascular disease, renal disease, and the stroke-like complication. And if it lifestyle modification and dietary modification can help you to reduce the blood pressure level. So here it is a beetroot, it is a rich source of dietary nitrate which convert into the nitric oxide, and it will help to promote the vasodilatation and thereby it reducing the blood pressure. The next to the need of the study. So hypertension, it is the early stage of, pre-hypertension, it is the early stage of pre-hypertension. So if it is not treated or if it can, we can prevent by lifestyle modification and the dietary modification, we can prevent to promote the pre-hypertension to the hypertensive stage. So beetroot juice, it is a dietary nitrate contained food which promote to the nitric oxide pathway and it promotes the vasodilatation and it will reduce in the blood pressure. So here this pilot study was conducted to assess the effectiveness of beetroot juice in lowering the blood pressure among the pre-hypertensive individuals. Then next move to the research methodologies I adopted during the study. Quantitative evaluative research approach was used. Quasi-experimental research design was done, and then a study was done in a selected areas of Surat. Sample was selected by non-probability purposes sampling technique, and 20 number of sample were there in pilot study. So among them, 10 were assigned to experimental group and other 10 were assigned to the control group. And here only the experimental group were received the interventions. So in the intervention in the pilot study was 150 ml of fresh beetroot juice administered once daily up to 3 months. And after the 3 months, the post-test was conducted. Then next, moving to the data compilation and the data analysis. So here it is the frequency and percentage of the frequency and the percentage of the social demographic variable. First is the gender. So in an experimental and in the experimental group, the male and female, there is a equally participants were there. And in a control group, 40% of sample were male and 60% of sample were female. And in an age group, there is in experimental group, 60% of sample were between the 40 to 50 years of age, and 40% of sample were having the 50 years of age. And in a control group, 70% of sample were between the 40 to 55 years of age group, and 30% of sample were above 50 years of age group. And the next social demographic variable were types of family. So in our experimental group, 60% of sample were living in nuclear family, 30% sample were lived in a joint family, and 10% of sample were lived in extended family. Whereas in a control group, 40% of sample were in nuclear family, 60% of sample in joint family, in a joint family. And then move next to the marital status of the sample. So in an experimental group, there is a 30% of sample were single, 60% of sample were married, and 10% of sample were divorced. In a control group, equally divided into the single, in a single criteria, in a single and the married criteria. Then move to the next, that is occupational status and the qualification. So in our occupational status, in an experimental group, 20% of sample were unemployed, 30% of sample were labored, and 40% of sample they are having the professional work, and 10% were self-employed. Whereas in a control group, 30% of sample were unemployed, and the 60% of sample were having professional work, and 10% of sample were having a sample. So 30% of sample were have the primary qualification, 20% of sample were have secondary, 30% of sample were having the graduation, and 20% of sample were had done that post graduation. And in a control group, 40% of sample had completed their primary education, 20% had done their secondary education, and other 20% are in a graduation and the post graduation. Then the next social demographic variables is the residential area of my sample. So in an experimental group, 40% were lived in a rural area, and 60% of sample were lived in a urban area. And in a control group, 50-50%, that is equally samples are divided into the rural and the urban area. Now moving to the types of the diet followed by my sample. So in an experimental group, 50% of sample followed the vegetable diet, 30% of samples were followed the non-vegetable diet, and the 20% of sample were follow mixed diet. In a control group, 50% of sample having the vegetable food having habit, 10% having the non-vegetable food habit, and the 40% of having a mixed diet. Then the next social demographic variable were check, that is smoking status and the alcohol consumption. So in a experimental group, 70% of my sample were having never smoked, and 30% of sample they were having a former habits of having a smoking. And then control group, 80% of sample they never smoked, and 20% having the habit of former smoking habit. And in a alcohol consumption, in experimental group, 70% of sample they never consumed alcohol. Only 30% of sample they were consuming alcohol occasionally. And in a control group, same like the experimental group, 70 they never consumed alcohol, and 30% they are having the habit of alcohol consumption occasionally. Then moving to the next social demographic variable, that is physical activity and the family history. So in a physical activity, experimental group, the samples are experimental group. Among them, 10% of sample were having a sedentary lifestyle, and 50% of sample were having a moderate activity, and 40% of sample were doing the regular exercise. And in a control group, 30% of sample were having a sedentary lifestyle, and 40% of the sample having moderate activity, and 30% were doing the regular exercise. The last social demographic data was taken, that is family history of hypertension. So in an experimental group, only 60% of sample were having the family history of hypertension, and in a control group, there is a 50% of sample were having a family history of hypertension. Then moving the next part of the data analysis, this is the blood pressure value which is collected during the pre-test. So during the pre-test, systolic and diastolic blood pressure was taken. Sample was divided into the experimental and control group. So during the pre-test, 100% of both group who are having the elevated blood pressure during the pre-test. Then next to the post-test value of the blood pressure. Post-test which is conducted after the 3 months of the intervention. Intervention was only provided to the experimental group. So after the intervention, the results are here. So that is the systolic blood pressure, 80% of the sample from the experimental group, they are having a normal blood pressure, and only 20% are having the elevated blood pressure of this study. The next analysis part, that is the paired T test. Paired T test. This test was performed to check the significance effectiveness of beetroot juice in lowering the blood pressure. So based on the tabulated value and the p value, that is 0.000, which is p value is less than 0.05 at the level of 95% of confidential interval. So this value, p value, it shows the significance results. Means it shows the significant effectiveness of beetroot juice, which is help to lowering the blood pressure. Then moving to the next part. Moving to the next, that is association part. So in the association of selected socio-demographic variable with a post-test systolic blood pressure, so there is a no socio-demographic variables were showing the significant association with the systolic blood pressure. Next association with a post-test with a diastolic blood pressure. So with a diastolic blood pressure, only alcohol consumptions were showing the association with a blood pressure value. Then next, that is a comparison other than alcohol consumption. Then this is the comparison of blood pressure between experimental and the control group. So here it is a p-value that is 0.01, which showing independent sample T test was performed, and at the level of significant 0.05. 0.05. So this is statistically significant. It's showing the effectiveness of beetroot juice, which is help to lowering the blood pressure. Then so it shows the significance value. And here is the discussion. As a discussion part, the finding of my pilot study, it suggests the potential beneficial of effect of beetroot juice in lowering of blood pressure, because the beetroot juice rich in a dietary nitric acid and nitrate, which promotes the nitric oxide pathway, and it will lead to the vasodilation. So the finding of this finding will provide the preliminary support to the further researcher with a larger sample size and the longer interventional period. Then moving to the next part, after the discussion, there is an implication of the research into the nursing practice. So this is by the preliminary evidence for a patient and the lifestyle modification. For a nursing education, so can enhance the awareness regarding the evidence-based dietary approach for a cardiovascular health. And for the future researchers, the findings may serve as a preliminary evidence for a larger study with a greater sample size. Then next to the conclusion, here I would like to conclude. The pilot study indicates the beetroot juice may be an effective dietary intervention to reducing the blood pressure among the pre-hypertensive individuals, and the findings suggest that regular consumption of the beetroot juice may support for a better blood pressure control, and it reducing the possibly risk factor of the cardiovascular health, stroke, and the renal disease. So, however, the large study with an adequate sample size and the longer follow-up periods are recommended to establish the more effectiveness of beetroot juice. The next is, so
Skip.
here are the references
No, skip.
I
No.
had gone through during
Can you just go to the methodology? Okay, QSCF.
So can we
Okay.
start discussing
Yeah.
Sonal ma'am, can we start discussing or do we need to do at the last? How is it
No, ma'am,
planned?
no, ma'am. You can start, ma'am.
Okay, so we can be, matlab we can ask questions like that
Yes, ma'am.
right now.
Yes, ma'am, you
Yes.
can ask.
Yeah,
That is what I
so
was just having observation regarding this research design. So I
yes,
thought it was a true experimenter, but it is a quasi only. Okay, no issue.
okay.
No issue, ma'am.
Now I
Continue.
think candidate number 1, right? Uh, Hello, am I audible?
Yes, ma'am. Yes, ma'am.
Yeah. So I just wanted to know that you have selected the participants at community level. Hello,
Miss Mitali, hello. Are you there?
Tell you just answer.
Mithali, can you hear us?
Yes, ma'am.
Hello.
Yes, ma'am. She is there, ma'am.
Yeah, Mithali, can you hear us? Sonal ma'am, please check no whether she is actually there or not, or shall we then?
Ma'am, she is there. Hello. Miss Mitali. Now it's time for question answer session. Our evaluators will
Hello,
ask
ma'am.
questions. Please
Is it
stay
Mithali
connected.
or
Yeah,
Mittal?
sure.
Mittal, ma'am.
I was
Okay, okay. I see. Okay, Mittal, can you hear
Actually,
us?
her name is Mitali.
Acha. Miss Mittal, can you hear us? Are we audible to you?
yes, ma'am. Yes, ma'am. My
Yeah.
voice is audible to you, ma'am?
Yeah, I can
Yes,
hear you
audible.
now. Yes. So basically, my
Okay,
first
ma'am.
question to you is, okay, you have selected the participants at community level. You have visited their homes, and that is how you have evaluated, you have taken the samples.
Yes, ma'am. I had selected the sample from my community level, and while the intervention, I visited their
I'm sorry,
home.
I can't hear you. Sorry. Hello.
Hello, ma'am.
Yeah. So you
So,
visited
ma'am,
individual
now it's
homes and
audible.
you, yeah,
My
you are
voice
audible now.
is
So you mean to say
audible.
that you have visited individual homes and then you have identified your samples by taking their BP on your own?
Okay. Yes, ma'am. I also do, and I took help from the health.
So you measured the BP having your instrument, your own instrument. How did you
Workers.
identify
I
that the
also
patient are
took
having
help
elevated
from
BP?
field health workers and A&M nurses who use.
Miss Mitali, please
Yes,
check
ma'am.
Sorry,
your
I
I can't
measured
hear
the
internet
blood
you.
volume.
pressure by using the my BP instrument, and then
Okay,
I
so
identified the person is having elevated blood pressure level.
so in your
Up to the
pre-test,
70 and continue
hello,
the ways.
in your pre-test, how many times did you measure the BP so that you came to a conclusion
Hello,
that
ma'am.
your
Voice is
samples are,
audible.
hello? Am I audible now?
Yes, ma'am. Hmm.
Okay, so my question to you
Ma'am,
is in your pretest, how many times did you measure the BP of your sample
yes, ma'am.
to
You are
come to a
audible, ma'am.
conclusion that they have
Yes.
elevated blood pressure? How many times did you measure the blood
Hello.
pressure to come to a conclusion that they
One,
have elevated BP in your pretest?
one, once in a day, same time, up to the 7 days. I measured the blood pressure, and then I came to know that person is having a pre-hypertensive blood pressure level.
7 days you visited the client and then you came to a conclusion like that.
Yes, it is.
Okay. So post-test, how many times did you measure the BP?
The post is the same, ma'am. Up to the 7 days, if the person is having a normal blood pressure, then it decided the person is reducing their blood pressure.
Okay. So every sample you did this way. That pre-test you went for 7 days, individual sample, and then you, ideally, how many times if you measure the BP, you can come to a conclusion that person is having elevated blood pressure? Standard, what is the standard thing?
As a standard thing, ma'am, twice in a day, in a relaxed mode, and in a activity stage, this both the stage were having the same blood pressure, then we can define the person as a pre-hypertensive or the hypertensive person.
Okay. And
So
did you
twice in
validate
a
your
day is a
instrument?
yes, ma'am. Caliber BP instrument was used during the study.
And how about ethical consideration, clearance certificate?
Ma'am, that was also issued by the Vidyadeep University.
Acha, you have the ethical clearance from your university.
University,
So
yes.
you can even you can also share your views, sir. So
Yes, sir. Yes, Mitali. It is a means a research design you use now that is a quasi-experimental. And that which type of research design you use? It was a non-randomized or a time series? Which one it
That,
was?
so that is a non-randomized.
Okay, okay, okay. Nice. Okay, very good.
okay, I just one more question from my end. Did you teach the participants how about the beetroot juice? So was it prepared by the
Um,
participants at their home like that? Your
Then for an
intervention?
initial day, I prepared and I used to give them. Then,
No, I mean to say
ma'am,
every
for the initial
how
days of intervention period, I used to
okay
prepare and I used to give them. Then,
at their homes.
then after I teach them how to prepare the beetroot juice at home.
So how can you be so sure that the intervention has been exactly followed the way you wanted them to do it as an investigator?
As the investigators, ma'am, I created the WhatsApp group and also I keep the data collectors like A&M nurses and female health workers. They used to visit their home daily. So by that we came to know person has taken the regular beetroot juice for 3 months, ma'am.
And one more thing I want to just ask, in your demographic variables, you have not mentioned about comorbidities. So all your clients, that is not a
Yes, ma'am.
variable that you need to think on. What if other than hypertension, they have other
Yes, ma'am. But
comorbidities? Then in that case, yeah, please go ahead.
ma'am, in my sampling selection criteria, so there are exclusion criteria like a person is having any other disease condition, so they were excluded from my study.
Okay.
Okay. Okay. So those who have having comorbidities were not a part of your samples.
Samples, yes, ma'am.
Okay.
Okay,
Thank
Mitali.
you
Go
so
ahead.
much,
No issue.
ma'am.
Thank you.
Thank
Thank
you
you
so
so
much,
much.
sir. Thank you, ma'am.
Thank you, sir and ma'am, for your valuable questions and constructive feedback. We now move forward to our next scientific paper, and I invite Ms. Bhavisa Champaneri from Tathya Nursing College, Chikhli. Over to you, ma'am. Ms. Bhavisa Champari, ma'am. Yes, ma'am. Please start your presentation. Hello. Bhavisa ma'am.
If she's not there, we can move to next.
Sir, she is there, sir. Bhavisa Champaneri. Hello. Bhavisa ma'am. Am I audible, ma'am? Yes. Please start your
Yes,
presentation, ma'am. Unmute yourself.
She's already unmuted.
Sonal ma'am, I suggest if you can go to the next participant,
Okay,
then you
okay,
can
ma'am.
connect to her so that she can
Okay,
be reachable.
okay, ma'am. So our next presenter, Miss Monica Gangoda from Vidyadeep Institute of Nursing, Surat. I request Miss Monica to do her presentation.
Good morning, sir. Good morning, ma'am. Myself, Miss Monica, PhD scholar, Vidyadeep Institute of Nursing. Today, I am going to present my pilot study with the study title, A Study to Evaluate the Effectiveness of Drumstick Leaf Soup on Hemoglobin Level among Teenage Girls at the selected school of Navsari, Gujarat. Objective of study, to assess the hemoglobin level among teenage girls before and after intervention to determine the effectiveness of drumstick leaf soup on hemoglobin level among teenage girls. Then to find out the association between pre-test, post-test mean score of hemoglobin level in experimental and control group with their selected demographic variables. Introduction. So anemia among teenage girls remains a major public health concern in developing countries. Teenage girls is a critical period marked by the rapid growth and increase the nutrition requirement, making girls particularly vulnerable to low HB level due to the inadequate dietary intake and menstrual blood flow. So here this slide shows the pilot study. So in that pilot study, distribution of sample, total 20 samples are there. In that 10 in experimental and 10 in control group. Then socio-demographic findings. So in that socio-demographic findings, in experimental age, total 40% teenage girls belong to the 13 years. Then 6% of teenage girls are belongs to the 14 years. Control group, 50% girls, teenage girls are belong to the 13 years and 40% belong to the 14 years. Then 10% in 15 years. Then in religion, 90% teenage girls belong to the Hindu religion. Then 10% belongs to the Muslim religion. In control group, 70% belong to the Hindu religion. Then 10% belong to the Christian religion and 20% belong to the Muslim religion. Then in experimentals, 60% having number of 2 siblings and 30% having a 3 sibling. Then 10% having a more than 3. In control group, 50% teenage girl having two siblings, then 40% having 3 siblings, and 10% having more than 3 siblings. Then in types of family, in experimental, total 40% teenage girl belongs to the nuclear family, 60% belong to the joint family. In control group, total 50% belong to the nuclear family and 50% belong to the joint family. Then in family income, in experimental, total 10% teenage girls family income is less than 5,000. Then 30% is having between 5,000 to 10,000. Then 40% is having between 10,000 to 15,000. Then in a control group, total 40% teenage girls family income is between 5,000 to 10,000, and 40% having family income between 10,000 to 15,000, and total 20% is having a more than 15,000. Then in education qualification of father, in experimental, total 40% teenage girl father qualification is illiterate. Then 30% having a school education, and 30% having a graduation. Then in control group, total 30% teenage girls father qualification is illiterate, 40% having a school education, and 30 having a graduation. Then education qualification of mother. So in that experimental, 50% teenage mother belong to the illiterate qualification, then 30 having a school education and 20 having a graduation. In control group, 60 having a illiterate qualification, then 20 having school education and 20 having a graduation. Then types of diet. So in that 30% belong to the vegetarian diet, and 70% having a non-vegetarian diet. In control group, 40% having a vegetarian diet and 60 belongs to the non-vegetarian diet. Then age of menarche. So in that experimental, 10% having a after 10 years, then 40% teenage girl having a menarche in between 10 to 12 years, and 50% is having a after 12 years. In control group, 20 having a after 10 years, then 30 having a 10 to 12 years, and 50 having a more than 12 years. Then in pattern of menstruation, so in regular, total 90% female teenage girls having a regular, then 10% having irregular, then 70% having in control group, 70% having regular and 30% having irregular. Then next slide. So this slide shows the pre-test hemoglobin level among the teenage girls in experimental and control group. So before intervention, experimental pre-test was, so in that 30% teenage girl having a mild anemia, then 70% having a moderate anemia. In control group, before intervention, 40 teenage girl having a mild anemia and 60 having a moderate anemia. So this is effectiveness after, before and after intervention hemoglobin level. So in experimental, before intervention, 30 having a mild anemia, after intervention, 17 having a normal. Then before intervention, experimental teenage having a moderate anemia, 70%. After intervention, 30 having a mild anemia. In control group, total 40 teenage girl having a mild anemia and 60 having a moderate anemia. After intervention, 50 having mild anemia and 50 having a moderate anemia. PAT test for the effectiveness of drumstick leaf soup on hemoglobin level among teenage girl with a same group. So here experimental group. So in experimental group, pre-mean is 9.96 with the 0.97 standard deviation, and post-test mean is 12.12 with the standard deviation of 0.55. Mean difference is 2.16. PAT t-value is 10.16 with the degree of freedom 9. So p-value is 0.0000312. That is the scientific significance at the 0.05 level. In control group, pre-test mean is 10.48 and with the standard deviation 0.95. Post-test hemoglobin mean is 10.44 with the standard deviation 0.95. Mean difference is minus 0.04. Paired t-test value is minus 0.32 with the degree of freedom 9. So p-value is 0.76, that is non-significance, scientifically non-significance at the 0.05 level. Then this is comparison of drumstick leaf soup on hemoglobin level among teenage girls between the experimental and control group. So here pre-test hemoglobin level in experimental group. So mean was 9.96 with the standard deviation 0.97. In control group, pre-test hemoglobin mean is 10.48 with the standard deviation 0.95. Mean difference is minus 0.52. Paired t-test is 4.85 with the degree of freedom 18. So p-value is 0.24, that is not significance at the 0.05 level. In post-test hemoglobin level, experimental group mean hemoglobin is 12.12 with the standard deviation 0.55. In control group, mean hemoglobin is 10.44 with the standard deviation 0.95. Mean difference is 1.68. Paired t-test is 0.48. Degree of freedom is 18. P-value is 0.00128. So this is scientifically significance at the 0.05 level. Then association. So association between the pre-test hemoglobin level in experimental group with that selected socio-demographic variables. So here p-value is more than p-value is more than 0.05 level. So there is no association between the socio-demographic variables in experimental group. Next slide, please. Here also in monthly income of family, education qualification of father, education qualification of mother, types of diet, age of menarche and pattern of menstruation. So here also p-value is p-value is greater than 0.05. So there is no significant association with the selected socio-demographic variables. Association between the pre-test hemoglobin level in control group with their selected socio-demographic variables. So here age, religion, number of sibling, types of family, monthly income of family. So here p-value is greater than 0.05. So there is also no association between the pre-test hemoglobin level in control group with their selected socio-demographic variables. So in education qualification of father, education qualification of mother, types of diet, age of menarche and pattern of menstruation. So here also p-value is more than 0.05 level. So there is also no association between the pre-test hemoglobin level with in control group with that selected socio-demographic variables. Association between the post-test hemoglobin level in experimental group with their selected demographic variables among teenage girls. So here also p-value is more than 0.05 level. So there is no association post-test hemoglobin level with their selected demographic variables in experimental group. Here also no association. Association between the post-test hemoglobin level in control group with their selected demographic variables. So in age, religion, number of sibling, types of family. So here p-value is also more than 0.05 level. So there is no association between the hemoglobin level in post-test control group with their selected socio-demographic variables. So here bibliography. Thank you. Thank you, ma'am. Thank you, sir.
Hello, Monica.
Hello, ma'am.
Okay. So basically, can you just let me know about your independent and dependent variables? आप मुझे specify करेंगे according to your statement.
Yes, ma'am. Uh, in my study, independent variables is HB level, and dependent variable is drumstick leaf soup.
Please correct your facts. Which is your independent variable in your statement, and which is your, again, I repeat my question, which is your independent variable and which is your dependent variable in your statement?
In independent variables, so drumstick leaf soup is a independent variables, and dependent variables is hemoglobin level among teenage girls.
So you said something else in your first answer.
Sorry, ma'am.
That is something that is important to know. And what was your method of sampling?
Ma'am, quasi-experimental research
How could
design.
you, okay, how can you come to the conclusion it is quasi?
We, with the after post test, HB level of teenage girls are improved.
You said no, your method of sampling is, you said your design is quasi, right? Sorry, I asked for, my question
Yes,
was
ma'am.
sampling, method of sampling, but then you told me it is quasi. Okay, but how do you know that, what criteria made it quasi as per your research problem statement? आपकी स्टडी को क्वाजी हम क्यों बोल सकते हैं? That's my question.
Because here, ma'am, we are not controlling the extraneous variables. So I choose quasi-experimental research design.
Nothing else?
No, ma'am.
Your method of sampling, your intervention doesn't matter? So again, my question is, what is your method of sampling?
Ma'am, non-probabilities purposive sampling method.
Okay. Why do you say it is purposive? You went to a school and you collected the school girls, no? So how can it be said as purposive?
Because, ma'am, I am selecting low HB teenage girls who having a low HB level
And how did you measure their hemoglobin level?
with the help of hemoglobinometer, ma'am.
With the help of
You will handle
and
that.
Hemoglobinometer.
You will handle that is?
yes, that's correct.
Yes, sir.
You will handle that is? The test will
Yes,
be?
yes, sir.
Okay. Sonal, will it be, means we are considering the pilot study for this scientific paper presentation? We have an criteria?
Sir, actually, it is not mentioned in our guidelines.
Okay. Because
But
pilot study, whether we are calculating or not, I don't know. If you are means accepting, then we will go ahead with that. We can present, but in larger sample, because it has been on a small samples, it is there. So, and it is not completed also. Yes, Monica, no, it is still means going on only.
Sir, pilot study is completed, sir.
Oh, the main study is going on.
Yes, sir. Study is going on.
How did you select your samples in control and interventional group, Monica?
Ma'am, with lottery method, I select my sample.
But yours is non-probability,
The purpose,
purposive.
purposive, no, you said purposive previously.
Yes, sir. Purposive, non-probability, purposive sampling technique.
Then how you change the, you will not change, no.
Yes, sir.
Then lottery method.
Sir, I'm little bit confused.
Actually, what you did,
Regarding
You must have had some idea, right? And how did you took samples from 4 classes or 2 classes?
Ma'am, from
Two
two
standards.
classes.
Two
Two
standards you have
class.
taken.
Yes, ma'am.
So which were those standards?
8th standard and 9th standard, ma'am.
So your demographic variable age group is 13, 14, 15, and 16, correct?
Yes, yes, ma'am.
So you mean to say all your samples were between 13 and 14?
Yes, ma'am. Some belongs to 13 years, some belongs from 14 and 15 years, ma'am.
So 15 years, the child is in which standard? You expect the child to be in which standard?
Ma'am, their admission is late in during schooling.
Okay, now you tell me, how did you come across ये मतलब आप एक क्लास में जाके ये 5 samples आपने 10 samples आपने कैसे लिए and how did you bifurcate them into control and intervention group? That's my last question to you.
Ma'am, I'm just checking their hemoglobin level, and samples are fit in my inclusion criteria. So that sample I selected in my pilot
So
study.
you monitored hemoglobin level of how many students and then you selected 20?
Ma'am, I selected 20 students. Sorry,
आपने
I
लेकिन
select.
मॉनिटर कैसे किया मतलब आपने कैसे मेजर किया सब कितने लोगों का आपने ओवरऑल मेजर किया तब आपको 20 सैंपल्स मिले
Ma'am, in one class there are 30 students, so I measured all 30 students' hemoglobin level.
so there were no
You said for
sections or anything
आपने बोला 2 क्लास में से किया तो फिर आप बोल रहे हो अभी 1 क्लास में से
सर
किया
एक क्लास में 30 थे और दूसरे क्लास में 20 स्टूडेंट्स थे.
तो 30 and 20 50 so among the
50
50 you
students.
selected 20
Yes, sir.
okay. यानी 20
and which
स्टूडेंट्स का एचबी लेवल लो था
Yes, sir.
ओके उससे भी ज्यादा थे या खाली बीसी आपने लिए
नहीं सर, वो जो बेस लाइन पे थे उनका ही सिलेक्ट किया था सर.
फिर आपने उनको ड्रम स्टिक का जो सूप है वो आपने कैसे एडमिनिस्टर किया उनको स्कूल में
मैम,
जाके आपने ये 20 स्टूडेंट्स को इंडिविजुअली दिया है एंड व्हाट
यस
इज द
मैम.
ड्यूरेशन एवरी डे यू
3
विजिटेड द स्कूल
यस मैम 3 मंथ के लिए दिया था.
तो मतलब आप खुद प्रिपेयर करते थे ड्रम स्टिक सूप घर से
यस यस मैम.
and you used to be visiting the school for 3 months.
यस मैम.
So did you take the parental permission for this?
यस मैम. Permission is taken, ma'am. Consent permission.
Of the parents.
Yes, ma'am.
and for the larger sample the same things you are going to do
Yes, sir.
how many sample for large main study
Sir, in 100 in control group and 100 in experimental group.
in a school how much strength is there
Sir, 12 standard.
12 standard till 12 standard the school is there no no
Yes, sir.
strength according to your age criteria 13 14 and 15
Yes, sir.
you selected the age criteria of 13 14 15 is it so
Sir, teenage girls from 10 to 19 years.
10 to 19 years
Yes.
okay
But you have
Okay.
selected only 2 classes.
Ma'am, in pilot study, I am selecting 2 classes for the 10 sample.
But we are discussing your this study right now. Anyways, which test did you, what is the reliability of your tool? What is the reliability score of your tool and which test did you use to identify reliability?
Taste retest method, ma'am.
what was the score
And use, Hmm.
That is, sir, 0.7.
Okay. But little confusions I think you are having in your studies. Okay, it is I think you are only not clear. Just clear about many things about with your guides. Okay.
Okay, sir. Thank you.
Because you are going to in a larger sample, you need a parent guide, parent supports, everything you required. Okay.
Yes, sir.
First, you just clear about your study. Okay. Because you are confusing many things here. Okay. Sometime you are selling two classes, sometime telling you are 20 to 19 years. So I don't know. Your tool data collection procedure, how would it be? Okay. So just be sure regarding these things, okay,
Okay,
before
sir.
ahead to the final study.
Okay, sir. Thank you, sir.
Thank you.
And little bit be clear with the design and certain questions what a sir said itself, that how do you do the sampling, what is your design, you need to check your facts for that. Rest is yeah, all the best.
Thank you, ma'am.
Thank you, Ms. Monica. Now moving forward, our next participant is Ms. Nikita Gamit from Vidyadeep Institute of Nursing. I request her to start her presentation. Over to you, Ms. Nikita Gamit.
Yes, ma'am. Good morning, ma'am. Good morning, sir. I am Nikita, PhD scholar, Vidyadeep Institute of Nursing, Vidyadeep University. Today, I am going to present my pilot study analysis. The statement of the problem. A comparative pilot study to assess the preliminary effectiveness of stress management training program versus self-instruction module on professional work performance and psychological well-being among nursing officers. Introduction. Nursing is a profession associated with considerable occupational demands, and they experience heavy workloads, long hours, and emotional challenges. And that is going to affect definitely their physical and mental health. And prolonged stress can lead to burnout, characterized by exhaustion, cynicism, and a decreased sense of accomplishment. The need of the study. Job stress brought about hazardous impacts not only on their nurses but also their ability to cope up and with their job demands. Workload related stress can affect both physical and psychological health and may subsequently affect the quality and efficiency of healthcare services. 87.4% nurses face occupational stress, but still there is no such organization available for managing their stress at their workplace. Therefore, the researcher has chosen this study as an opportunity to assess about the effectiveness of stress management training program versus self-instruction module on professional work performance and psychological well-being of nursing officers at selected hospitals at Tapi district, Gujarat. The objective of my study is to determine the pre-test score of experimental group and control group on professional work performance and psychological well-being of nursing officers. The second objective is to evaluate the effectiveness of stress management training program on professional work performance and psychological well-being to experimental group 1 and self-instructional module on professional work performance and psychological well-being on experimental group 2 of nursing officers. To compare the effectiveness of stress management training program versus self-instructional module on professional work performance and psychological well-being of nursing officers, and to find out the association between pre-test professional work performance and psychological well-being with selected socio-demographic variable of nursing officers. Okay, the research methodology. A quantitative research approach is used in this research. It is a quasi-experimental, non-randomized control group pre-test, post-test design. And the sample for my pilot study is 13 nursing officers. And I have selected them on basis of my inclusion and exclusion criteria. There are 4 groups in my study. 2 groups are of experimental group, that is experimental 1 and 2 is of control group. The independent variable is stress management training program and self-instruction module, and the dependent variable is professional work performance and psychological well-being. The tool I have used to check the professional work performance and psychological well-being, both are my standardized tool. The data collection procedure is, I have done first the pre-test before conducting my intervention, and then to experimental group 1, I have given stress management training program for 20 days. In my stress management training program, madam, I have included patterns of breathing exercise, muscle relaxation techniques, and guided imagery meditation. These 3 things is included in stress management training program. And to experimental group 2, I have given self-instructional module, that is self-made module by me. And then I have done post-test using same standardized tools. The data analysis I have done with descriptive and inferential statistics and to compare it. Madam, the next slide. This is the tool I have used, that is 6-dimension scale. Madam, in this scale, there is, for the assessment, there are 2 columns, that is column A and column B. So whatever the question I am asking in my tool, my sample will answer in column A for the same question and in column B for the same question. So column A says that how often the nurse is doing that particular activity as a part of their job, and in column B says that how well they are doing that particular activity as a part of their job. So for one question, they will answer it in column A as well as column B. The next slide, it is the tool for my psychological well-being by REF. It is a standardized tool. Here they have to answer for psychological well-being as a strongly agree up to the strongly disagree. The next slide. Pilot study was conducted at selected PHC and CHC at Tapi district, Gujarat. The study was carried out from 9/3/2026 to 23/5/2026. And the sample distribution is in experimental 1 and control 1. There were 7 participants. In experimental 2 and control 2, there were 8 participants, and total 30 samples from a pilot study. Next slide. This slide depicts the effectiveness of stress management training program and professional work performance. So it is of experimental 1 and control 1. So 57.14% participants were occasionally doing that particular activity in pre-test, and 42.86 were frequently doing that activity in pre-test, and in post-test 42.86% samples were frequently doing that activity, and 57.14 samples were occasionally doing that activity. In control group, 14.29% samples were occasionally doing that activity. In 85.71% participants were frequently doing that activity in my pre-test, and in control group, every participant were occasionally performing those activities in the post-test. The next slide, it shows the effectiveness of self-instructional module on professional work performance. So experimental group 2 and control group 2. So 0% participants were never doing that activity, while 62.5% participants were occasionally doing, and 37.5% were frequently doing in the pre-test, while in post-test 25% were doing frequently and 75% were doing occasionally doing that activity, and 0% were frequently doing in post-test. In control group 2, the in pre-test score, 75% were occasionally doing and 25% were frequently doing, while in control group, while in post-test, 0% were frequently doing and 50% were occasionally doing and 50% were never doing those activities. It is the effectiveness of stress management training program and professional work performance, that is for column B, that is how well they were doing that activity. So it is about experimental group 1 and control group 1. So in experimental group 1 for pre-test, 85% were well doing those activities, 14% were satisfactorily doing those activities, and 0% samples were no one was doing very well activities in experimental 1. For post-test score, in experimental 1, 14.29% were satisfactorily doing those activities, while no one was well doing, and 85.71% samples were very well doing those activities. In control group 1, every sample was doing well of those activities, and it's same for the post-test, all samples were well doing those activities. This is the effectiveness. The next slide. This is the effectiveness of self-instructional module on professional work performance for column B. This is for experimental group 2 and control group 2. To the group whom I am going to give the self-instructional module. So 12.5% were satisfactorily doing those activities, and 87.5% were well doing. And in post-test, all samples were well doing those activities, and in control group 2, 87.5% samples were well doing those activities, 12.5% satisfactorily doing those activities, and in post 2, all samples were well doing those activities. This is the effectiveness of the effectiveness of stress management training program on psychological well-being. So till now I have presented about professional work performance, and this is about psychological well-being. This is about experimental group 1 and control group 1. So in pre-test, all were moderately doing those activities, while in post-test, all were high doing those activities. All were having high psychological well-being. And in control group 1, all were having, in pre-test, all were having moderate psychological well-being, and in post-test also, all were having moderate psychological well-being. This is the next slide shows the effectiveness of self-instructional module on psychological well-being. So it is of experimental group 2 and control group 2. So the moderate and high, so all were having moderate psychological well-being in pre-test, while in post-test, 6 were having moderate psychological well-being, while 2 samples have high psychological well-being, and in control group 2, 7 samples were having moderate and 1 was having high psychological well-being, and in it is same for the post-test score. The next slide shows the t-test for comparison of professional work performance, that is for the column A among staff nurses in experimental group 1 and control group 1. So the in pre-test for experimental 1 and control 1, the mean score is 137.8 and control 1 it is 145.7 with degree of freedom 12, and the p-value is 0.18, which is non-significant. And for the post-test, the mean score for experimental 1 is 134.4 and control 1 it is 116.7 mean score with degree of freedom 12, and the p-value is 0.00, which is statistically significant. The next slide shows the t-test for comparison of professional work performance for column B among staff nurses in experimental group 1 and control group 1. The pre-test score, the mean value for experimental 1 is 133.0 and control 1 it is 135.5 with degree of freedom 12 and p-value is 0.71, while for the, which is statistically non-significant, while for the post-test experimental 1 the value is 169.8 and for control 1 the value is 147.5 with the degree of freedom 12 and the p-value is 0.01, which is statistically significant. And then the next, the t-test for comparison of psychological well-being among staff nurses in experimental 1 and control 1. For the pre-test experimental 1, the mean score is 172.4 and control 1, the mean score is 183.5 with the degree of freedom 12 and the p-value is 0.23, which is non-significant, while the post-test experimental 1 is 245.5 and control 1, the mean score is 192. With the degree of freedom 12 and p-value is 0.00, which is statistically significant. In the next slide, the t-test for comparison of professional work performance among for the column A among staff nurses in experimental group 2 and control group 2. For pre-test of experimental group 2 and control group 2, the experimental group 2 mean score is 129.6 and control group 2 127.5. with the degree of freedom 14 and the p-value is 0.79, which is statistically non-significant. And for the post-test experimental 2 and control 2, the mean score is 111.7 and 107.1, and with the degree of freedom 14 and the p-value is 0.37, which is statistically non-significant. The next the next slide, it is t-test for comparison of professional work performance for B column among staff nurses in experimental group 2 and control group 2. For the pre-test experimental 2 and control 2, the mean score is 134.7, and for control 2 it is 139.2 with a degree of freedom 14, and the p-value is 0.22, which is statistically non-significant. And for the post-test experimental 2 it is 154.6, and control 2 it is 150.8 with a degree of freedom 14, and the p-value is 0.37, which is statistically non-significant. In the next slide, it shows the t-test for comparison of psychological well-being among staff nurses in experimental group 2 and control group 2. For the pre-test, experimental 2 and control 2, the mean score is 180.3 and 188.8 respectively, with the degree of freedom 14, and p-value is 0.23, which is significantly which is not significant. And for the post-test, for experimental 2 and control 2, the mean score is 203.2 and 202.5 respectively, with the degree of freedom 14, and the p-value is 0.942, which is not significant. This slide depicts the comparison between the effectiveness of stress management training program versus self-instructional module. So for the professional work performance, about column A, how often they are doing those activities. For the experimental group 1 and 2, the mean score is 134.4 and 111.7 with the degree of freedom 13, and p-value is 0.001, which is statistically significant. For the professional work performance post-test, for column B, which is how well they are doing those activities. For experimental 1 and experimental 2, the mean score is 169.8 and 154.6 respectively, with the degree of freedom 13, and the p-value is 0.05, which is statistically significant. For the psychological well-being post-test, for the experimental group 1 and 2, the mean score is 245.5 and 203.2 respectively, with the degree of freedom 13, and the p-value is 0.001, which is statistically significant. So in this comparison, all the p-value is less than 0.05, and every value is statistically significant. In the next slide, I have shown the
Excuse me,
associate.
we are not able to see your slide. Sorry to interrupt, but we are not able to see your slide.
Um, well, Madam, the slide is shared by the host college only.
I can only read Gamit Nikita coming on my screen. Is it the same for all?
Ma'am, just
Yes.
hello. Just 2 minutes, ma'am.
Okay.
Hello.
हेलो मैडम प्रेजेंटेशन भावना अभी चाहिए भी रखा जूम मीटिंग क्या चाहिए दोबारा कनेक्ट करना है नहीं मिल भी है ना हमारी मिल हेलो
Hello, madam. May I start? My slide is my slide visible, madam?
Yes,
Yes,
yes.
it is visible. Please.
This slide shows the association between professional work performance and selected socio-demographic variable among nursing officers. The socio-demographic variable were age, gender, marital status, socioeconomic status, educational qualification, their present designation, total clinical experience, working hours per week, average patient allotted in each shift, and have they attended any special training program for psychological well-being or else any seminar for professional work performance. These were my selected socio-demographic variable, out of which the socioeconomic status and seminar for professional work performance and total clinical experience have the p-value less than 0.05, which is 0.04, 0.00, and 0.35, which is less than 0.05, and it is statistically significant. The next slide shows the conclusion. Madam, next slide. Madam, okay, this shows the conclusion. This shows the conclusion. The study is a cross-experimental study, and non-randomized control group I have selected. And for the I have done the comparison of effectiveness of stress management in a self-instruction module to assess it on professional work performance and psychological well-being. I have used both standardized tool for my study, and the finding of the study generates evidence regarding the usefulness of structured stress management intervention for nursing officers. Next slide, madam. The recommendations. Future research may include randomized controlled trials to provide stronger evidence regarding the comparative effectiveness of different stress management
As
interventions.
you are doing the
Long
pilot study, so recommendations not required because you have not completed the final study. Okay, so when you complete your final study, recommendations can be added.
Okay, okay. I'm
Go
so
ahead
sorry, sir. I
next.
will keep it in my mind.
Next.
Sir,
Next.
next is references that I have used.
Okay, next.
And thank you, sir. Thank you, madam.
Yes, Inumila.
Yeah, Sonal ma'am, is there any time criteria for the presentation? Just wanted to know.
Yes, ma'am. Yes, ma'am. There is 10 minutes
Mm.
for presentation.
So every candidate has to complete the presentation in 10 minutes?
Yes, ma'am.
Okay. Yeah, yes, Miss Nikita. Can we have your statement slide, please? Problem statement slide.
Yes, madam. Okay, a
Okay,
comparison.
you mean to say it is preliminary effectiveness of stress management training program versus self-instructional module. Can you just help me with the operational definitions of your problem statement? Specifically, preliminary effectiveness means what?
Actually, madam, preliminary, I have used
No,
word
there
in
is
my
no operational definition in the slide, so don't need to search for. I just want to know from the author, from the researcher. Yeah, so what do you
madam.
understand? What should we understand by preliminary effectiveness?
Madam, preliminary effectiveness, I have used this word preliminary specifically over here, madam, because I am going to do the stress management training program for 20 days, and then I am going to do the post test, and this is for my pilot study. And
No,
madam,
I'm sorry. Preliminary डालने का मतलब क्या है आपका? सिर्फ preliminary word डालने का मतलब क्या है?
How did you
Hello?
define that word? Means
Yeah.
madam is
yes,
asking
yes,
regarding the
madam.
operational definition. How did you define these words? What is your thought behind the preliminary?
I need to revise it, madam.
You completed your pilot study.
Yes, yes, I have completed, sir.
Happiness or stress
What is your
management training.
what
Okay.
is the need of your study? Why you wanted to try both these methods, and that too in, I think there are two independent variables. You mean to
Yes,
say
madam.
stress management training program. What are the
Yes, yes.
techniques that you have used here in this intervention?
Madam, in stress management training program, mainly three things I have included is patterns of breathing exercise, muscle
Okay.
relaxation technique, and guided imagery
Okay.
meditation.
So how did you administer this to your every client? How much time were you spending on every client for this intervention?
Madam, it was of 45 minutes to the each client. And at one center, I was able to get almost madam, 5 to 7 nursing officers at a time. So during
So
that break time,
how many total PSCs and CSCs you have included? Settings कितने हैं आपके?
madam, it is of Tapi district, and in madam, for my pilot study, the PHC and CHC I have included is around 22 PHC, madam, because I was not able to get all the samples at a time. As in CHC, they were
Just
having
now you
shift
said no,
duties.
5 to 7 samples you could get at a time. Just now you said. Then how did you मतलब आपने जो number of PSCs exactly कितने लिए हैं आपके pilot study के
Madam,
लिए?
madam, out of 5 to 7 samples, half were in my control group and half were in my experimental group, madam. So while giving the intervention, only 2 to 3 nursing officers were available at a single PHC and CHC for my intervention, and others were into the control group, madam.
So just a very clear answer I expect from you. What is that you visited this PHC and all, right? So you mean to
Yes,
say
yes,
you went to 22 PHCs to collect how many? What is the total count of your samples, including all
thir-
groups?
30, madam.
40.
30, madam.
30. So that is okay, 30 samples you took overall in all four
Huh,
groups. And
huh.
for these 30 samples, you visited how many PHCs?
But madam, I have visited 22 PHC, CHC. And madam, if I am getting five nursing officers at a PHC, for example, madam, at least 1 or 2 stays back for their professional work, and others were ready to for my
My
study.
question to you is that only. I'm coming to that question. So, what is the minimum duration of your intervention?
45 minutes, madam.
No, overall intervention आपने जो pre और
20,
post के बीच में
20 days, madam.
20 days.
Yes.
So, for 20 days, you did intervention on every client, right? Every client means,
Yes.
let us say 20 samples
Yes, madam.
for intervention. तो आपने 22 PHCs में से, so you could manage like travel to so many PHCs altogether.
No, madam. It was not done at a time. It took me more months, madam.
So what you
Madam,
took almost,
I have mentioned the date that it is from 9/3 to 23/5/2026, madam.
so that is 2 months.
हाँ, madam.
So that's what my question is. When you're doing such an intervention with only 20 participants as your stress management training program, which is more tedious task of intervention,
हाँ,
જીનલ
and
મેડમ
you
ને આપો કે
visited.
સ્ટુડન્ટ ના સિગ્નેચર તો બાકી છે સર ઉપવાસ છે ના સજેશનો હા ઉપવાસ છે સોમવાર એ સમોસા
So,
મને કીધું
Miss Nikita,
yes,
little,
madam.
it's like, how could you manage 22 PHCs traveling for 20 days, and that too, it's little difficult. Okay, very simple. I want to ask you one question.
Yes, madam.
Okay, you have calculated the data analysis you have done, right?
Yes,
You
madam.
have said your how many, that means you have performance activity के आपने दो tools रखे हैं, A और B and all that, right?
Yes, yes, madam.
So I saw in one of your slide that your control group had मतलब 100% उनका effectiveness आया है in spite of like this intervention, I mean to नहीं, आपका performance activity वाला जो group है,
Hmm.
that is your E1 and C1, right? That is
Hmm.
experimental 1 group, experimental 1 and C1. And
Yes, madam.
yeah. So the control group has been also effective without the intervention. So what is your say on that? If you have gone through your
Madam,
data analysis, yeah.
yes, madam, I have gone through this. Madam,
हाँ,
I
तो
guess that
उसमें
Madam, I guess that nursing officers may not be aware about these psychological well-being and professional work performance, but after seeing the tool, I'm talking about control group, madam. After seeing the tool, they may be aware about some of the aspects about work performance and psychological well-being, and they may have gone, they may have referred some
So you mean to
referred.
say your intervention, even if like, what is the percentage of error then in that case? अगर आप खुद as a researcher, if you're assuming that
Uh,
there could be this problem that the samples must have visited, मतलब gone through some kind of help for some AI or
no,
let's say. So
hmm.
what is the percentage of error of your study then in that case?
Uh, mm, Madam, I have not controlled any extraneous variable in my study.
Okay. So are you sure that your intervention has made an impact? Can you be
Yes,
sure in
madam.
such case then if your
Yes, madam.
extraneous variables have not been controlled?
Madam, it is quasi-experimental, so my extraneous variables are not controlled. But while seeing the comparison for the madam p-value, everything is statistically significant. So I think my intervention is effective, madam.
Okay.
Sir, excuse me, sir, are there any suggestions for me for my study?
What are the phases of burnout, Nikita? Last question to you.
Madam,
Hello?
I need to revise that, madam.
When you're discussing about burnout, so what can be the phases of burnout that you have to cover? You have already mentioned in your introduction, you can see the thing, right? So
Yes,
basically
yes,
आपका जो
madam.
tool होना चाहिए वो burnout related tool होना चाहिए. That is what your introduction says, right?
Madam, I have
This
included
impacts
that.
the slide that is there in front of me says that prolonged
Uh,
stress can relate it to burnout characterized by exhaustion, cynicism, and
uh,
decreased personal accomplishment, right? That is reduced.
hmm.
So basically, why you did not include something related to burnout rather than just going on matlab stress when you're discussing about stress, work-related burnout?
Madam, actually, it is if the nursing officers are having demanding workloads and long hours, then it can impact physical and mental health, and it can lead to burnout and exhaustion. And these may not happen. To prevent it, I'm giving the intervention.
Okay, thank you so much.
Thank you, madam.
Thank you, Miss Nikita Gamit. Thank you, ma'am and sir. Now moving forward, our next participant is Miss Bhavisa Champaneri from Tathya Nursing College, Chikhli. Over to you, ma'am.
Sonal ma'am, how many participants do we have in total?
Ma'am, total 10 participants are there. We have completed
And
3.
and currently we are finished with 3. So I would just request you if we could maintain the time limit.
Yes, ma'am.
Yeah, so that at least let them finish it within the given time frame so that
Okay, ma'am. So 10 minutes for presentation and maximum 5 minutes for discussion. Question
Now,
answer session. Okay. Over to you, Miss Bhavisa, ma'am.
Good morning, ma'am. Now I am audible, ma'am.
Yes, you are
yeah,
audible.
please continue.
So, good morning, sir. Good morning, ma'am. So, I am the second participation of the Vibrant Conference. So, for my title of the study is the Assess the Effectiveness of Structured Teaching Program on Knowledge and Practices regarding the prevention of urinary tract infection among the female students in the Puspam Girls Hostel of Uka Tarsaria University, Bardoli. Next slide, please. The introduction of the study is we know that the urinary tract infection is the most common seen in the females. So the risk factors are the most probably in the adolescent girls who have the low water intake, infrequency voiding, and the poor menstrual and the sexual hygiene. The preventive measures for the UTI, that is promoting the good hygiene practices, staying the hydrate, avoiding the irritations, and the practicing the safe sex, ensuring the proper genital hygiene, treating the underlying condition, considering the probiotics, and avoiding the harsh chemicals during the washing the genital areas. Next slide, please. The need of the study is in our India, the urinary tract infection are the common issue among the adolescent girls, including those residing in the college hostels. The prevalence of the urinary tract infection in India between 21.8 to 31.3%. The prevalence of the urinary tract infection in India includes up to 8% of the girls in the India are getting the urinary tract infection during the adolescent period. So here the data shows that the prevalence of the urinary tract infection is more into the adolescent girls. Next slide, please. The objective of the study is to assess the knowledge of the female students regarding the prevention of the urinary tract infection before and after the structured teaching program, to assess the practice of the female students regarding the prevention of the urinary tract infection before and after the structured teaching program, to correlate the knowledge and practice regarding the prevention of urinary tract infection among the female students, to find out the association of the post-test mean score of knowledge regarding the prevention of urinary tract infection among the female students, and to find out the association of the post-test mean score of practice regarding the prevention of urinary tract infection among the female students. The research methodology of this study is, the approach is the quantitative research design. The main design is the pre-experimental one group pre-test post-test design. The research setting is the Puspam Girls Hostel of the Maliban campus, Uka Tarsaria University. The populations are the all hostel girls residing in the Bardoli. The target population is all hostel girls residing in the Maliban campus, Uka Tarsaria University. The samples are female students from the Puspam Girls Hostel of Uka Tarsaria University, Bardoli, who fulfill the inclusion criteria. The sample size is 100. The sampling technique is non-probability convenience sampling technique. The interpretation of the data was done by the inferential and descriptive statistics. The criteria for the sample selection, in the inclusion criteria, the non-paramedical female students staying in the Puspam Girls Hostel and who are willingly to participate in the research study. The exclusion criteria of the study was the female students are already suffering from the urinary tract infection and who are not present during the data collection. The result of the study is, here the graph shows that the first graph is for the knowledge score. So here in the pre-test, the 83% the participants are fall down into the moderate knowledge, and in the post-test 82% of the the participants are the falling into the adequate knowledge. So here it shows that the structured teaching program is effective for the increasing the knowledge. The second graph shows that in that the 60% of the female participants are falling down, having the average practice, and in the post test there is 27% are fall down into the good practice. So here also the result shows that the structured teaching program is effective in the improving in the practice also. So here the table shows that the effectiveness of the structured teaching program, the result is the knowledge of the female students regarding the prevention of the urinary tract infection. The mean knowledge score is, the pre-test score is 15.88 and the post-test score is 20.35. The mean difference score is 4.47. Standard deviation is 3.13. So here, and table value is 2.26. So the p value is 0.00. So it shows that the significant. So here the PAD test is there. So here we can see the structured teaching program is effective for the improving the knowledge. The next table is for the calculation of the PAD test for the practice. So here also the mean practice score is, the pre-test score is 7.65. The post-test score was 9.99. The mean difference score is 2.28 and standard deviation is 2.65. The value of the PAD test was 8.59 and the difference is 99 and table value is 2.26. So here also the p value is 0.00. It shows the significance. So here also we can show that the standard structured teaching program is also effective for the improving in the practice of the adolescent girls. This table shows that the correlation between the knowledge and practice score. So post-test knowledge, the mean score was 20.35 and post-test practice score was 9.93. So here the correlation score of this, that is 0.081. So p value is 0.42. It is non-significant. So here it shows that the knowledge and practice does not have any correlation. So association of the knowledge score. So here with the demographic variables, so monthly income is have the significant with the knowledge score. So here for the association with the between the practice score with the social demographic variable. So here also the education status shows that the significant, monthly income also shows that the significant, and the marital status also shows that significant of the social demographic variables. So the discussion, the major finding of the study for the knowledge. So here we already shows in the table. So p value, PAD test value, calculated value was 14.24 and the table value is 2.26. So here it shows that p value was significant. For the practice score also same. The pre-test score is 7.65 and it increased with the 9.93 into the post-test. So here also the p-value was 0.000. So it is also shows that significant. Same as for the correlation. So here also we shows in the table. So there is no significant relationship between the post-test knowledge and the practice. We also shows that a significant association between the mean post-test knowledge score with the monthly income, and in the practice there is a significant shows into the monthly income, education status, and the monthly income. Sorry, it is marital status. Sorry. So comparative study is the major finding of the study reveals that there was the significant difference between the mean pre-test, that is 6.01, and post-test is 14.91. So knowledge score with the positive mean difference of the 8.18. So calculated t value of 26.32 is higher than the table value of 1.645 at the 0.05 level of significance. So there was significant association between the pre-test knowledge of the adolescent girls at that age and the monthly income of the family. So the implications for the nursing practices. So here the students who have the symptoms suggestive of the urinary tract infection, and encourage them to seek immediate the medical evaluation rather than the self-medicate. So health screening and the counseling the program can be organized periodically in the girls hostel in the collaboration with the medical personnel. Implications for the nursing education. So students can train to identify the common risk factors and early symptoms of the urinary tract infection, and to provide the appropriate health education to the hospitalized girls. So implication in the nursing research, we can also implement the different practices and the preventive measures in our research. So here also the identify the factors associated with the urinary tract infection, preventive practices such as age, education level, socio-economic status, hygienic practice and fluid intake, and the health-seeking behaviors. So the conclusion of the study was the research finding includes the structured teaching program was the highly effective and improving the female students' knowledge regarding the prevention of urinary tract infection. So significant improvement in the knowledge level were observed, and with the program leading to the shift from inadequate to moderate knowledge and poor to good practice among the students. The recommendation in the nursing and health professionals should conduct a periodical awareness in the counseling sessions on the personal hygiene, adequate fluid intake, regular urination, and the appropriate perineal hygiene. And in educational materials, we can also provide them the pamphlet, poster, charts, and audiovisual presentation should be made available in the girls' hostel to reinforce for the information regarding the urinary tract infection prevention. So in the reference, the bibliography include 33 references from the previous dissertation research articles.
Can we skip this? Can we skip this? Thank you so much.
Ma'am.
Sonal ma'am,
Thank
can we
you,
skip this?
Thank you,
Yes,
ma'am.
ma'am.
Thank
Yes,
you, sir,
ma'am.
for evaluating me.
Would sir like to start or shall I start?
You can start, ma'am. Sorry.
Yeah. Ma'am, your good name, Miss Bhavisha, right?
Yes, ma'am.
Yeah, Miss Bhavisha, you have, can you just help me define your variables, please?
Ma'am, in independent variable, it is structured teaching program with the prevention of the urinary tract infection, and my dependent variable is knowledge and practice of the urinary tract infection.
Okay, so what tools did you use for identifying your dependent variables?
Ma'am, structured knowledge questionnaire I used for the knowledge, and the checklist for the practice.
So how did you check the practice?
Practice in that they including all the hygienic practices, they are using the common washroom or not, they are
No,
cleaning
you
their
sorry, yeah, please continue.
They are using the common washroom or not in the hostels, they are using the common washing machine in the hostel or not, they are maintaining the proper perineal hygiene during the
See,
menstruation.
Bhavisha, you mean to say, so your tool was an checklist? Was it an observational checklist or what was it?
नहीं मैम, सेल्फ इंस्ट्रक्टेड चेकलिस्ट मैम.
सो अगर आप सेल्फ इंस्ट्रक्टेड बोलते हैं या एक्सप्रेस चेकलिस्ट बोलते हैं या एक्सप्रेस्ड प्रैक्टिस बोलना चाह रहे हैं, व्हाट डू यू मीन?
No, ma'am.
When you say practice, you have added in your statement as just practice, right? But ideally, you made them, did you observe what they are doing, or you made them just write in the form of a express checklist?
No, ma'am. They only given the data.
So it is an expressed practice, you mean to say? So as a researcher, ideally, if you write that practice, then as a researcher, you were not present in how they were maintaining or how they were taking measures to prevent urinary tract infection. But आपने उसको observe नहीं किया है कि whether they were doing their hand washing and all that, nothing like that. They were just supposed to fill the questionnaire, right? Hello?
हाँ मैम, हाँ.
So that becomes expressed practice, Bhavisha.
Okay.
So then your statement should have structured teaching program on knowledge and expressed practice, which means the researcher is not going to observe the practice directly.
Okay.
And it is not an observational checklist. It becomes an express checklist where you expect the samples to write in the answers. Was it a yes or no, or what kind of tool was it?
Yes or no, ma'am.
Yes or no. And they just had to tick mark on what they must be following, correct?
Follow. Yes, ma'am. Yes or no, like that.
So that becomes an expressed practice.
Okay.
Okay, so when you use words in your statement, because if you write practice, then it is assumed that or it is expected that you have been the observer and you have observed them every step. You have observed every step of theirs in preventing whatever they do in prevention of UTI. So that is one suggestion that I would like to add on,
Okay, okay.
that your statement should have had expressed practice. And how did you select the samples?
Ma'am, with the non-probability convenience sampling.
What was the total number of strength of the hostelite students?
That is nearby 400, ma'am.
Out of 400, you selectively
100 samples.
100 samples.
Yes,
And
ma'am.
what time of the day did you opt for giving teaching?
On the daytime, ma'am, when this hostel is in the campus only, ma'am. So, so at their lecture time, they went and did the giving the lecture.
So you went there in their hostel premises and then you gave structured teaching program, like that?
Hmm.
तो at a time आप कितने samples को साथ में इकट्ठा कर पाते थे?
50-50, ma'am.
How many?
50.
15 or 50?
50.
Okay, so you mean to say that आपकी 50 samples आपको साथ में मिले
हाँ,
for
ma'am.
one teaching?
Mhm.
Okay. I think, sir, you can add your suggestions.
No problem, ma'am. We can continue. Next candidate.
Next, please.
Thank you, sir. Thank you, ma'am.
Thank you.
Okay. Thank you, Ms. Bhavisa Champanetti, ma'am. Now moving forward, our next presenter is Professor B.K. Dhinda, ma'am, from Vidyadip Institute of Nursing, Surat. Over to you, ma'am.
Himanshu, sir.
Yes, ma'am.
Sonal, ma'am, just a minute. Himanshu,
Yes.
sir, can we
Yes,
do
ma'am.
something? Can we ask them directly to go to the objectives and the methodology
Yes,
and
sure, ma'am.
like that?
Sure, ma'am. Sure,
है
sure.
ना, so
The
that we can
problem statement
exactly
and with the objectives,
yeah.
yes.
So we
Critical statement.
request all the participants to start with your statement. Yeah, and directly move on to your objectives. And lastly, if you want to discuss recommendations, but please discuss it in short.
Good morning, ma'am. Good morning, ma'am. Ma'am, are you hearing me?
Yes.
Namaste, sir. My title of the study, ma'am. Hello, ma'am.
Yes, please continue, ma'am.
My title of my study, ma'am, study to assess the effectiveness of music therapy on physiological parameter of elderly people on old age home at Abu Road district, Siroi. Introduction of my study.
Can you please take to the study title?
Yeah.
Problem
Yes,
state. Yes. Okay.
A study to assess the effectiveness of music therapy on physiological parameter of elderly peoples of old age home at Abu Road district, Siroi. Pardon, sir.
Hello. Ma'am,
Yes,
please
Yes,
continue.
Ms. Linda, can you please speak?
Yes,
Can you
yes.
tell the
Slide is being fixed.
Ma'am, you have to just explain the statement, objectives, and findings. Please start with
Okay.
your objectives.
My objective is to assess the physiological parameter of elderly people residing in an old age home before administering music therapy. To administer music therapy to the selected elderly people residing in the old age home to assess the to assess the physiological parameter of elderly people after administering music therapy. Then to determine the effectiveness of music therapy on physiological parameter. Determine the effectiveness of music therapy on physiological parameter among the elderly people by comparing the pre-test and post-test finding. To find out the association between pre-test physiological parameter and selected demographic variables such as age, gender, educational status, marital status, duration of the stay in the old age home, and existing health condition. Hypothesis. Madam, shall I read out hypothesis?
Ma'am, you can move to the methodology.
A quantitative research approach with pre-experimental one-group pre-test and post-test research design was used in the study. 30 elders at old age home abroad was implemented the music therapy. And my research approach is a quantitative research. Research design is that is pre-experimental one-group pre-test and post-test design. And variable of my study is music therapy is an independent variable. Dependent variable, I mean like your blood pressure, pulse rate, respiratory rate, and oxygen saturation and blood sugar. Then setting up the study, madam, it is conducted in a selected old age home that is specific name is Simmoni home in the Abu Road. Population, total population, the residing people in the old age home 30. My sample size is 30 only. And technique I use purposive sampling technique. Data collection I have done, madam, demographic data and physiological parameter like a blood pressure, systolic and diastolic, respiratory rate, and oxygen saturation, blood sugar is assessed. Pre and post assessment is there. Data analysis, madam. Collected data are organized in tabulated form.
Yeah, next skip.
Paired piece test I used. This is my result, madam. Blood pressure systolic. The mean and post-test pre-test post-test mean was calculated. T-value and P-value. It was with the help of a statistician. I checked all this blood pressure, systolic, diastolic, heart rate, respiratory rate. Everything I found in a difference that the P-value size I have taken that 0.05 only, and my result was coming in less amount. The music therapy is effective for the old age people, those are staying in the old age home. Physiological parameter.
If you have explained it in the table, you can move to the next slide.
Major finding, madam, significant reduction in the blood pressure it was observed. The mean systolic BP decreased from 140.2 millimeter of mercury to 130.1. That is the mean value, that millimeter of mercury. The mean diastolic pressure BP reduced from 90.4 millimeter of mercury to 82.2 millimeter of mercury. Improvement in heart rate and respiratory rate also observed, ma'am. The mean heart rate reduced from 80.5 beats per minute to 75 beats per minute. The mean respiratory rate also decreased, that is 18.2 breath per minute to 16.3 breath per minute. Increase in oxygen saturation, that is observed 95.3 to post 97.2 percentage, and reduction in the blood sugar level. Mean blood sugar dropped into 120.3 mg per dl to 110.2 milligram mg per dl. The statistical significant, their all results showed a statistical significant difference with p-value of less than 0.001, confirming the effectiveness of music therapy. The study demonstrated that the music therapy significantly improved the physiological health in elderly individuals by reducing the hypertension, lowering the heart rate, improving oxygen saturation, and increasing tissue perfusion. This suggests that music therapy can be used as a non-pharmacological intervention for improving overall well-being of a geriatric people, those are residing in an old age home. P-value is also calculated less than 0.15, and the difference between pre-test and post-test physiological parameter is considered statistically. It is significant, and the null hypothesis is rejected. Music therapy is effective in influencing the physiological parameter of the elderly participant, and the reduction in blood pressure and heart rate is indicated better cardiovascular health. The improvement in respiratory rate and SpO2 suggest enhancing lung function.
I think good afternoon, ma'am. Yeah, ma'am, how many physiological overall parameters you have taken?
Yes. Physiological parameter: blood pressure, systolic, diastolic, and heart rate, respiratory rate, SpO2, saturated pulse, and blood sugar, blood glucose level.
That means almost, ma'am, you have taken dependent आपके variables हैं 1, 2, 3, 4, and 5 variables you have taken. Like
Yeah,
that.
madam.
Okay,
Yeah.
and which music therapy you mean to say, ma'am? Which music therapy? It means something that is played on the
Relaxing music, mainly, and meditative music therapy.
so
Like
this
God's,
intervention, okay. So you have specifically designed this music therapy, or is it been already standard, मतलब already कहीं पे बना हुआ था and you have used it?
हाँ मैडम, it is specifically मैडम my self design है music therapy as well as relaxing music and meditative commentary music. Means inside the music, madam, there is a voice commentary also to guide the people what they are going to be think positively, and in between there will be music. They can dance like a little bit position, they can sing, they can flow with love like in the God's name. So slow movement is also there together in a specific hall. I combine together and play music loudly with one speaker. Then with the music, they will listen for 5 minutes, one music. After that, I'll commentary them how to get relaxed, how to be positive in the situation, how to be healthy. Like that commentary also included with that music therapy.
Okay, ma'am, my question to you is, how did you maintain or manage the homogeneity of your samples? Because you have taken 5 physiological variables. So how did you need to make sure that your samples are homogeneous? So how did you manage that homogeneity of the samples, 30 samples?
Actually, madam, I have not gone through these things what you are asking, ma'am. I have only one means independent variable I have taken into consideration, pre and post. So continuously in the first, once I checked on pre, then after giving them 1 month this music therapy, then I took the post.
No,
Then
ma'am, my question is, sorry to interrupt. My question is, out of 30 samples that you have taken, All 30 had hypertension.
No, ma'am. All 30 was not there.
So
I
I
think,
mean to say you must be having some inclusive and exclusive criteria for your samples, right?
yeah, ma'am.
So ma'am, can you just help us with that?
Ma'am,
How did
the
you take
member,
your samples? What were your
like,
inclusive criteria and exclusive criteria?
inclusive criteria, madam, those are interested, willingly they are interested to listen music with meditative way, spend their time for 1 hour every day. So I have taken them. Among them, madam, very few are they are having BP, but they are under control. They are taking their medication also. Those are having
So in that
hypertension.
case, ma'am, how can you come to the conclusion that because of music therapy, their blood pressure has reduced?
Hey, madam, because they are very old and since many, like 20 to 25 years, they are continuing their medicine, same medicine. Like 2% they are taking continuously, Telmakind 20. So every day they are taking this 20. Along with that, I have checked the old age home, the sister are there with me. I have taken their past history also. Their BP was maintaining. They not get suffer in between any. So like the
Ma'am,
normal people.
what is the standard deviation of your samples when it in regard to blood pressure?
Blood pressure, ma'am, that is standard
Pre-test
deviation is
and post-test. Post-test we can discuss later. Before you started your intervention, you must have got the pre-test mean. But what is the standard deviation of your samples?
madam, that is very, I think 2.3, ma'am.
Plus or minus, you said, ma'am, can you take that slide, please? Where we are discussing the findings pre and post.
Yes, ma'am.
Yes,
Yes.
exactly. So मैम यहाँ पे आपने SD नहीं डाला है.
मैंने मैडम मीन रखा है, हाँ.
नो बट अगर आपके पेशेंट्स ऐसे मतलब आपके क्लाइंट्स ऐसे भी हैं जिसमें कुछ लोग हैं बीपी वाले हाइपरटेंशन वाले कुछ लोग नहीं है तो देयर इज अ बिग डिफरेंस दैट हैज टू बी हाईलाइटेड इन द फॉर्म ऑफ SD.
यस मैम, जी, या मैम.
दिस इज जस्ट माई बिकॉज सी मैम आपने इतने सारे फिजियोलॉजिकल वेरिएबल्स लिए हैं एंड द थिंग इज नाउ ब्लड शुगर व्हेन यू से which blood sugar were you considering, random blood sugar or
Random,
fasting
madam.
blood sugar?
Yes, ma'am, random.
So did you have a prescription for all the samples too that did you have the authority to collect their blood samples as a researcher?
Yes, ma'am. This old age home is belongs to our organization only. Then this is our. I was indirectly. I was previously was the assistant manager for this old age home. So now at present age I am looking after a nursing college. So the permission I got from that manager, and I use the glucometer. And the patient also they are very well known to me, like means familiar to me. Those are the staying there.
Because आपका अगर आप random कह रहे हैं तो आपका blood sugar is pre-test mean is 120.3
Yeah, ma'am.
and your post-test mean is 110.2.
Yeah.
So when you say it is random sugar, so all your samples are already in their can you say that they were already in their normal values?
Maximum, madam, it is there in normal value only because they are under
So your
treatment.
samples did not, your samples had diabetes or not, whether they were on treatment or not. So such things are important, ma'am, when you are testing your intervention on physiological parameters. So when you decide about BP, when you decide about blood sugar or SpO2, a lot of attention needs to be put on the homogeneity of your samples. Then only we can come to the conclusion that our intervention was effective in bringing any difference in the samples. That's it. Thank you so much from my end.
Thank you, ma'am.
I'm just concluding with the madam's note only that you should to maintain the vitals of this one. Okay, when we are doing the music therapy and all. Okay. All the best. No issue.
Thank you, sir.
Thank you, ma'am. Now our next Presenter is Miss Pratiksha Parmar from Vibrant Nursing College. Over to you, Miss Pratiksha. Good morning, ma'am.
खत्म जीतू मेरा खत्म है सुन साइंस
Can I start, ma'am?
Yeah.
Yeah.
Yes, you can.
Yeah. I am Pratiksha Parmar, MSc Nursing first year student from Vibrant Nursing College, Surat. Today I am going to present my quality improvement initiative titled Breaking the Silence, and evidence-based quality improvement initiative to strengthen nurses speaking up culture. This initiative focuses on an important aspect of patient safety, helping nurses recognize safety concerns, communicate them confidently, and escalate them appropriately. So, why speaking up matters? Nurses are often among the first healthcare professionals to identify patient safety threats, infection prevention concern, communication breakdown, and unsafe practices. However, recognizing a concern does not always mean that the nurse will speak up. There can be a sequence of hierarchy, fear, uncertainty, and finally silence. For example, imagine that the nurse noticed that the patient is showing early sign of deterioration. The nurse recognizes that something is wrong, but hesitate to inform a senior because of fear of being judged. If the concern is not communicated, the opportunity for early intervention may be missed. When nurses speak up appropriately, the concern can move through recognition, communication, escalation, action, and ultimately contributing to the safer patient care. So, speaking up is not simply about having confidence, it is an important part of patient safety. So, why this is quality improvement initiative? The need for this initiative emerged because several barriers can prevent nurses from speaking up. These include hierarchical barriers, fear of negative reactions, uncertainty about escalation pathway, previous negative experiences, workload constraint, and lack of feedback. For example, a nurse may notice that hand hygiene was missed before a procedure. She recognized the problem, but because the person involved is senior to her, she may hesitate to speak. This gives us an important message of like recognition of a safety concern is not equal to speaking up about it. The nurse may know that something is unsafe, but still remain silent because of fear and uncertainty. The intervention was therefore because of structure communication appropriate approach, including ARHQ team steps, COOS, SBAR, advocacy, and assertion. The primary objective of this initiative was to strengthen nurses' speaking up culture for the patient safety and infection prevention. The specific objective were to first assess barrier to speaking up, second, improve confidence and respectful challenge of unsafe practices, third, strengthen knowledge of clear escalation pathway, fourth, promote feedback and close the communication loop, and finally sustain a safer culture. For example, the goal is not for a nurse to simply say there is a problem. The goal is for the nurse to be able to communicate the concern clarity, respectfully, and through the correct escalation pathway. The methodology is evidence-based quality improvement project using the PDSA cycle, plan, do, study, and act. The project included three nurses at Manisha Hospital, Vadodara. An anonymous pre and post intervention survey was conducted to assess speaking of behavior and psychological safety. The intervention was organization bundle. This intervention, the COOS communication model, which I applied for intervention, concern, uncomfortable, safety issue, and stop and notify. And next slide, please. The other intervention for speaking up culture, respectful challenge training, leadership support, structure escalation pathway, closed loop feedback, COOS communication tool, safety hurdles and team communication, education and awareness, and last recognition and positive reinforcements. improvement in speaking up culture. Now I would like to present the key findings. Overall, all 6 positive indicators improved after the intervention. Safety confidence increased from 87.8% to 92.3%. The
You can discuss in
points
short.
percentage to 95. Okay, ma'am. Overall, the presentation reports an improvement from 78.1 percentage to 86 percentage, presenting a 7.9 percentage point improvement. To understand this practically, imagine a nurse who previously recognized a safety concern but was unsure about whom to approach.
Reduction in speaking barriers. Please continue.
After the intervention, is more likely to know who to inform, how to communicate the concern, and how to escalate it if necessary. Therefore, the improvement is not only about numbers, it represents improved confidence and capability in speaking up.
Next, please. Oh, change. I
Yes, whatever.
Previous slide, please, ma'am. Okay. The intervention was also associated with the reduction in several barriers to speaking up. The largest reduction was seen in the fear of being a troublemaker, which decreased by 12.6 percentage point. Uh, Next slide, please. What changed? When we look at the overall findings, 4 major changes can be highlighted. First, confidence improved, with IPC speaking up confidence increased from 76.8% to 87.8. Second, capability improved. Third, feedback improved. And fourth, fear decreased. Implication for nursing. In nursing practice, COOS can be integrated into routine clinical communication. Respectful challenge should be a normalized escalation pathway should be clearly communicated and feedback should be provided after concerns are raised. In nursing education, speaking up skill can be incorporated in orientation and continuing education through simulation scenarios, and students and nurses can practice situation involving infection prevention, patient deterioration, medication safety and communication breakdowns. In research, future studies should include larger samples, assess sustainability over 6 to 12 months, evaluate patient safety outcomes, and use controlled research design. Next. The conclusion and recommendation: increase speaking up confidence, increase escalation knowledge, improve perception of feedback, and reduce hierarchical and interpersonal barriers. Based on these
Skip,
findings, 6
nice.
recommendations are proposed. First,
Skip. What was that last slide? If you say something. What it is your research article or research study or problems, what it was?
sir, this is the evidence-based quality improvement initiative.
Just can you go to the first one? Okay, evidence-based policy.
So you will put it under what title, which title? When it comes to scientific paper presentation, आप इसको क्या title देंगे?
Evidence-based practice, ma'am.
Evidence-based practice, but it is a research paper, problems, what it is?
So in scientific paper presentation criteria, it was evidence-based practice also. So I
Evidence-based. Understand. So results parts, how did you got means how you can strengthen the nurse in speaking up in the culture? Can you
sorry,
take
sir.
me to the results? Can you take me to the result?
Yes, sir.
Pre and post. So what this result shows: safety, confidence, challenge, unsafe practice, leadership, support, escalation, IPC confidence. How did you got these results? By which method?
Likert scale scoring, sir.
Likert scale.
I taken first pre-test. Yes, sir.
Yeah.
How
Can you
many
explain
samples
that
were there?
procedure?
Yes.
Sorry.
Sorry, sir.
No, it's okay, sir. Same question.
Can you explain this procedure? Means how did you means talk with the staffs and all?
Yes, sir.
How did you
First,
communicate?
First, sir, I took a pre-test from 23 nurses on available on clinical duties, and I given the survey and analyze every nurse's scoring like these parameters: safety, confidence, challenges on practices. uh, and after that I took a class training, which I mentioned in PPT, like Coos communication tool and other intervention. And after I
Pratiksha,
took
what
a
are you
senior
testing
staff
here?
and in charge training.
Miss
Barriers,
Pratiksha,
ma'am.
what are you testing here? What are you wanting to find out? What outcome are you wanting from your study?
Ma'am, what kind of what
आप
what
क्या
kind of
टेस्ट कर रहे हो?
barriers is जो बैरियर
If
है
you
मैम,
say that
कौन
you
सी
have done a
चीज है जो
survey,
स्टाफ को?
अगर आप कह रहे हैं कि आपने
यस
सर्वे
मैम.
किया है तो दैट मीन्स यू आर नॉट टेस्टिंग एनीथिंग. लेकिन अगर आप प्री एंड पोस्ट बता रहे हो आपके फाइंडिंग में, यू हैव मेंशन्ड एज प्री एंड पोस्ट एंड देन यू हैव सेड दैट आई हैव गिवन सम ट्रेनिंग, then you are testing some of your method of teaching or some of your, so basically what is your research design over here? What is it? Something, if you say it is an experimental, then what is your intervention? If you say it is a non-experimental, then which research approach you have used? Please define that.
Ma'am, design is evidence-based quality improvement project, and framework is plan, do, study, and act PDSA cycle, and pre-post evaluation design.
And how did you take these 23 samples?
On duty, available, and willingly ready to participation.
So was it a hospital?
Yes, ma'am.
Okay. And nursing officers हैं आपके samples? Nursing मतलब you mean to say staff nurses or
Staff
admin,
nurse.
higher end staff मतलब sister in charges? Who were your exact samples?
Staff nurse.
Staff nurses. Okay.
Yes, ma'am.
And you just went and just whoever you came across, if they were willing, you just took them as your sample. That's it.
Yes, ma'am. Yes, ma'am.
Which hospital it was named?
Marengo Asia Hospitals, Vadodara.
What is the bed
They
strength
given
of
the
that hospital?
permissions of asking this kind of questions?
Yes.
Yeah.
Yes, sir.
Did they ask?
Yes,
Did
sir.
they given permission?
Yeah, yes, sir.
So can you not put it as a qualitative study?
Okay, yes, ma'am.
I'm asking this question to you. आप इसको एक qualitative title दे के आप उस हिसाब से you could have taken it forward, because ideally you want to know from them that what they are actually practicing, right?
Yes, ma'am.
It's an interview method or a questionnaire method? What was it?
Questionnaire. Questionnaire.
Questionnaire. Okay. So how many tools were there?
Only one, madam. This in this
You said no
uh,
previously Likert scale you use.
yes, sir.
Oh, then questionnaire method.
बेसिकली फॉर एग्जांपल मैम, अभी आप जैसे देखा है तो क्या करोगे आप, ऐसा मतलब एक सिंपल क्वेश्चन था एंड देन लाइकर्ट स्केल था कि पैरामीटर से ये बैरियर्स का मैंने लिस्ट आउट किया था और ग्रेडिंग रखा था, मतलब स्कोरिंग 0 to 5 कि अगर आप किस चीज़ से आपको स्पीकिंग अप आप नहीं कर सकते, जैसे कि अभी कोई एस्केलेशन पाथवे का नॉलेज नहीं है आपको, लीडरशिप सपोर्ट नहीं है, कौन सा चैलेंजेस है, तो ऐसा डिस्क्राइब किया था, तो उसमें स्कोरिंग किया था।
No, see, actually, Pratiksha, there are two things that you're assessing, if I'm not wrong here. One is, are they speaking up or not? That is one thing you mean to, मतलब वो आपका एक variable है, research variable है.
यस
And second, you want to know the associated factors.
यस
Am I right? So,
यस
आपने
मैम,
to know their speaking up tendency, which tool did you use? Likert scale or questionnaire? Or was it
लाइकर्ट
an
स्केल,
interview method?
लाइकर्ट स्केल।
Likert scale. So what were the levels of that Likert scale? Categories क्या थे उसके? मतलब आपका outcome क्या Likert scale का? आपने improvement जो define किया है ना speaking up का, तो
यस
what
मैम।
would be मतलब high speaking up, low speaking up क्या है आपके scales क्या है? Categories क्या है?
मैडम जो फैक्टर्स मतलब मैंने डिस्क्राइब किए थे ये बैरियर्स, उसमें वो लोग 0 to 5 का रेटिंग कि आप बोल सकते हो, कभी कभी नहीं बोलते हो, या एब्सोल्युटली आप बोल सकते हो किसी के भी सामने, तो मैंने एग्री, डिसएग्री और स्ट्रांगली एग्री, स्ट्रांगली डिसएग्री, ऐसे मतलब स्कोरिंग रखा था।
Speaking up के levels क्या थे आपके? Improvement in speaking up, when you say, no, you said that your slide right now is visible in front of me. You say safety, confidence. Is improve, you have the main title is improvement in speaking up culture, correct? The slide that is right now visible
यस मैम।
in front of me. So when you say pre was 87.8 and post was 92.3,
हम्म।
am I correct? That is your percentage
यस
of improvement. Now, अगर
यस
आपने
मैम।
Likert scale रखा है तो Likert scale का after you score all the items of every sample and what is their cumulative scores, then you divide them into certain levels. When we say attitude, so we say favorable and unfavorable, right? So similarly, speaking up के लिए आपका क्या था, outcome क्या था? How many samples did not speak? So it was not that they did not entirely speak, but they would be having different level of speaking up. So what was that?
Actually, it was missed from my side.
So usually you must have come across, no, where people say mild, moderate, and severe in different
Yes,
variables. So when you say
yes,
improve,
ma'am.
so like certain samples who were not at all speaking, maybe low in speaking,
Yes,
must have improved after your training, must have improved to moderately speaking. So have you not
yes, ma'am.
categorized that part of your research variable?
No, no, ma'am.
Okay, ठीक.
Thank you.
Thank you so much.
Yes, Pratiksha, you have taken a very good steps of doing this kind of the studies actually. Okay. And future also you are
Thank you, sir.
supposed to be have this kind of the studies. Okay. Because evidence-based practice are really problem solving approach it is. Okay. So from my side, it
Yes, sir.
is really, but we need to have a certain expertise in the doing this kind of the study where of course, the evidence should be there, some clinical expertise as you are taking for the staff nurses. So clinical expertise we need it required. So this kind of the expertise, if we have now, will really help the nursing research to bring a
Yes,
data
sir.
such kind of the things. Okay, and we can help the nurses also, and your course your studies improvement and speaking up culture. The nurses are somehow कहीं ना कहीं उनकी आवाज को दबा दिया जाता है. So
Yes,
that
sir,
is a very good
definitely.
uh, दिया है अपना ये initiation. Okay, in
Choice of
future.
selection of
Mm,
topic.
means in future also you supposed to take this kind of the topics, okay, and bring the datas like this, okay, and if hope so, if you publish, uh, don't limit the publication from here itself. Go some further publications also, okay. So it will really help you.
Yes, sir.
Thank you. Thank you.
In future,
Little
I
bit you need to work
definitely
on the
do this.
methodology, Pratiksha. Just work on a
Yes,
bit
ma'am.
of strategically methodology पे काम करिए so that you are able to portray it in the
Okay,
best
ma'am.
possible way.
Yeah, thank you, ma'am. Thank you, sir. Thank you,
Yes, Sonal
Pratiksha.
madam, next. Yeah,
Yes,
next.
sir. Yes, moving forward, our next presenter is Miss Meghna Rathod from Vidyadeep Institute of Nursing. I request her to start her presentation. Over to you, ma'am.
Am I audible?
Yes,
Yes,
audible.
ma'am.
Sonal madam,
Yes.
actually this is not my PPT.
Okay, ma'am. We will arrange. We call next participants, Mr. Pritesh Patel.
Hello, ma'am.
Yes, sir.
I'm audible?
Yes, sir.
Yes,
Yes.
audible,
Please
Pritesh.
continue, sir.
Good afternoon, sir. Good afternoon, ma'am.
Very good afternoon. Come to the problem statement.
Okay. Sir, this is the procrastinations visuals, a very common situation among the students. The students know that a task need to be accomplished, but they continuously postpone it. Its simple behavior of doing it later can gradually become an academic concern. So this bring us to the problem addressing in this present study. So my title of the study is the study to assess the effectiveness of structured procrastination training program on the level of knowledge regarding academic procrastination among the nursing students in selected nursing college of Surat. So the introduction, we all know what we should do. We know when we should do it.
Mr.
Yet
Pritesh, you can
sometime
directly
to
move to the objectives, please.
objective. Okay, ma'am.
Yeah,
To assess the
just stick to the
pre-test level
objectives
of
and
knowledge.
methodology.
Okay, ma'am. To assess the pre-test level of knowledge regarding the academic procrastination among the nursing student in nursing unselected nursing college of Surat, then administer to structure procrastination training program to the nursing students, then assess the post-test level of knowledge regarding academic procrastinations, the compare with the pre-test post-test knowledge score, and they determine the association between the pre-test level of knowledge regarding the academic procrastination and selected socio-demographical variable. So this is my hypothesis. Methodology in the research approach is quantitative approach. Research design is a pre-experimental research design. One group pre-test, post-test design. Research variable is independent variable is structure procrastination training program. The dependent variable is the level of the knowledge regarding academic procrastination. Selected nursing college, Surat. Nursing students. Here's my samples, and the sampling technique is non-probability purposive sampling techniques. So this is a structural procrastination training programs. Over we have to use 6 modules. Know the procrastination. First is the understanding the procrastination. Why we the procrastination is to identify the procrastination. Time to take control. Then plan for procrastination, how to reduce and beat the distractions, your control and start, don't delay, act, and my action plan is an improvement for how to reduce the procrastination, how to improve the knowledge of procrastinations. So the result in the section 1 is a description of socio-demographical variable. Section 2 is the pre-test, post-test level of knowledge regarding administered procrastinations. Comparison of mean
Skip.
pre-test, post-test knowledge score.
Skip.
Okay, so this is the frequency in
Can you
percentage.
come
So
directly to
this,
your findings, Pritesh?
yes, ma'am. This is the frequency in percentage for the some
So
variable like
only
age,
highlight
gender,
which is
year.
more significant.
Yes, this is the pre-test level knowledge, ma'am. In the total participation is the 60. Adequate knowledge with 43 students is 71.7%. Moderate adequate knowledge is 14 students, 23.3%. Adequate knowledge is 3 students for 5%. Pre-test mean score is a 9 and standardized division is a 4.53%. Their majority of students had inadequate knowledge regarding the academic procrastinations. So in the largest portion for the participation belong that inadequate knowledge category before the intervention. So this is the post-test knowledge score. In the so inadequate knowledge, the 2 students for 3.3%. Moderately adequate knowledge is 13 students, 21.7%. Adequately knowledge is 45 students, 75%. Post-test means 22.68. And standard deviation is 5.44. So this post-test finding that demonstrate a substantially improvement in the knowledge. So the visuals show that clearly shift that toward the adequate knowledge categories compared with the pre-test measure largest portion for student achieving adequate knowledge. So, and the next one is a comparison of the pre-test post-test score. So that pre-test mean score is a 9 and post-test is 22.68 and mean difference is 13.68. T value is a 65.40s and P value is a 0.001. So that highly significantly the effective the structure procrastination program. So that graph is clearly demonstrate the increase the mean knowledge score after that intervention. The mean score is higher and either the support the statistically finding. So these highly improvement of the signification. So this is the association. In this association, previously academic performance, daily study hours, daily mobile and social media using previous exposure for informations are that significant and another's variables are the not significant.
So when you
Ma'am,
okay, recommendation. Yeah, you can skip this slide.
okay, ma'am.
Yeah.
Ma'am, over.
Sonal ma'am, I just want to know from you that
Yes.
are there any criteria for PPT preparation?
Yes, ma'am. Already we have.
Are there any guidelines for PPT presentation, or they can make the way they want in whichever their concept?
No, ma'am. Actually, sequence has been given to them. That sequence they have to follow.
Otherwise, there is nothing like that. Okay, मतलब utilization of AI, not ऐसा कुछ अलग से criteria
No,
नहीं
no,
है,
ma'am,
right?
no. Just
Okay.
font type
Linked in
and
the
all these
sub.
things.
Okay, background white होना चाहिए ऐसा कुछ भी नहीं है ना? So that because see
No,
the
ma'am, no.
judgment will depend on that.
Yes, ma'am.
Okay, Mr. Pritesh.
Yes.
Yeah, Mr. Pritesh, आपने ये procrastination पे जो topic लिया है, have you
Yes.
taken any professional training to conduct?
Ma'am, I have training in a CBT therapy. I'm training a CBT therapist.
So you have undertaken
Because
a
of
CBT
my
therapy
my
course.
the actual PhD statement is the study to assess the effectiveness of the cognitive behavior therapy on popcorn brain phenomena and procrastination among the adolescent students in selected higher education school.
So you yourself have undertaken a training on, you are authorized to conduct a training on procrastination and it's,
Yes,
you
ma'am.
mean to say procrastination and what? How would you complete it? The topic
Sorry,
is procrastination is, you mean to say procrastination is good or not good?
I'm not good at
So
procrastination.
come to your statement then, please.
Okay.
So when you say effectiveness of structured procrastination training program, so you mean to say how to reduce
Yes, ma'am.
procrastination training program on
But
how to
ma'am,
prevent procrastination. Your
ma'am, first
title
of
says
all, I
something
will
else.
check the knowledge. I will check the knowledge. The students
Your
having the
title
knowledge
is
for the
saying
procrastination, they are
structured
not
procrastination.
program. Yeah. Main motto, ma'am, this
Structured.
reduce the procrastination.
So basically you are doing an STP,
Yes, ma'am. Yes.
right? Structured training
Yes, yes.
program
Yes,
on
yes, ma'am. STP.
measures to
Why?
reduce.
Because, ma'am, my main study is already going to the
That is,
CBT
let's
therapies.
not discuss
And
that.
okay,
Let's
ma'am.
not discuss that. Let's concentrate on right now what you're presenting. So basically,
Okay.
your title should say structured training program on measures to reduce procrastination. Correct?
Yes, ma'am.
हाँ, मतलब आप प्रोक्रेस्टिनेशन को प्रमोट नहीं कर रहे हो, आप प्रोक्रेस्टिनेशन को reduce करने
नहीं
के
नहीं
लिए
मैम,
you are training
रिड्यूस
the
करने के
students.
लिए उनका नॉलेज में देख रहा हूँ कि उसके नॉलेज में इंक्रीमेंट इम्प्रूव हो रहा है कि नहीं हो रहा है.
Knowledge related to what?
For reducing
Regarding academic
academic
procrastination.
yes ma'am,
ठीक है, okay. So don't you think that there should be some refinement in your problem statement?
yeah ma'am, I
I
think so
need
the
your
level of
view on this.
knowledge reducing regarding academic procrastination.
Because here
Fine.
you are not promoting procrastination. You are explaining the students how they can reduce the how they can use the techniques to reduce procrastination so that it can improve their academic performance, right?
Yes ma'am.
So
How
where
many
the
nursing
knowledge you are
colleges did
assessing.
you select? Sorry, sir,
But
please
ma'am,
continue.
Sorry, sir, sorry, sorry. Yes, ma'am, continue.
How many colleges you have selected?
only just ma'am one.
So you have just selected one nursing college, and how many students? What are your total sample size?
60
60.
students.
Belonging to
Yes.
which program and which year?
GNM first year, second year, and BSc first year, second year. 30 students I will choose.
30 students from GNM program and 30 from
BSc program.
BSc nursing program. Okay, and what is your
Yes,
method
ma'am.
of sampling?
Yes, ma'am.
What is your method of
Yes, ma'am.
sampling?
Sampling, purposive sampling, ma'am.
So why you could not go for a random sampling method, at least in the class itself?
Yes,
आपने
ma'am.
फाइनल
Yes.
सैंपल्स कैसे सिलेक्ट किए? जो 30 फर्स्ट ईयर के मिलके, फर्स्ट और सेकंड ईयर के मिलके जो 30 आपने लिए, वो कैसे किए?
Ma'am, if willing the students to join the study, so that's why I'm choosing. I'm not randomization because my research design is a pre-experimental, ma'am. That not randomization, sir.
Okay, but how did you come across 30 students only? For example, if 50 students would we be willing to appear for your, want to participate in your study? Say for example, first year GNM में 50 students
Yes,
हैं
ma'am.
आपके वो college में. All 50
Yes,
want to
ma'am.
participate in your study. Still you would want to select only 15 students from that class. How would you do that? How would you do that? How did you do that,
Ma'am,
supposingly?
फर्स्ट लाइक द क्वेश्चन हमने लाइक क्लास में जाके या जो भी टॉपिक्स है उसके बारे में हमने मैंने दी इंफॉर्मेशन दिया एंड देन आफ्टर इफ जो इंटरेस्टेड स्टूडेंट्स है उसको मैंने मेरे रिसर्च के अंदर शामिल किया.
ओके, बट 20 एग्री हो रहे हैं बट आपको 15 ही लेने, तो कैसे लेंगे आप?
For my convenient, ma'am, feel that the researcher because the pre-experimental research design, ma'am.
ठीक है, ओके. Thank you.
Pritesh,
Thank you.
can you come to the main slide?
Yes, sir.
So in my way, the procrastinations. Why you think about taking a nursing students or something?
Because of, sir, the nursing students having some like the educational assignments, clinical burdens, and all these things have, and then students are started the first year and second year, so many confusing regarding the medical field. So that's why most of the students having a procrastination behavior will see.
इसका जैसे कि ये तो कि मैं कहाँ समझता हूँ कि प्रोक्रेस्टिनेशंस का मतलब क्या होता है कि भाई बच्चा कोप अप नहीं कर रहा, अवॉइडेंस है बराबर के आज का काम आज दिया है वो नहीं कर रहा है,
हाँ
मीन्स
हाँ हाँ सर।
डिलाइंग दी वर्क, ओके, यानी कि उसको
यस
नेक्स्ट डे
सर।
में टारगेट कर रहा है बराबर, दैट इज अ प्रोक्रेस्टिनेशन मेरे हिसाब से।
यस सर।
अभी इसमें आप नर्सिंग स्टूडेंट्स का नॉलेज असेस कर रहे हो, व्हाई इट इज रिक्वायर्ड
सर वो
एंड व्हाट इट
उनको
विल बेनिफिट
अवेयरनेस रहे,
फॉर द नर्सिंग स्टूडेंट्स इन।
लाइक उनको अवेयरनेस रहे सर कि उनको पता है, जैसे कभी कभी क्या
इट
होता है
इज अ
सर
वन
कि
काइंड ऑफ
उनको
द
पता है
कोपिंग,
कि ये
नहीं नहीं प्रीतेश,
उनकी नीड्स
आप
है।
समझ नहीं रहे हो,
हाँ
प्रोकास्टिनेशन
हाँ।
ये क्या है कि एक तरह का बिहेवियर है बराबर।
यस सर।
इट इज
यस।
अ वन काइंड ऑफ द बिहेवियर ऑफ द स्टूडेंट्स, ओके, कि भाई वो तो आज तुम भी हो स्टूडेंट, आज मैं भी स्टूडेंट था, कल कोई और भी
यस।
स्टूडेंट है, आपके हाथ के नीचे भी बहुत सारे स्टूडेंट्स हैं। मैं ऐसा
यस
नहीं
सर।
सोच सकते कि इसमें ये प्रोक्रास्टिनेशंस का जो आपने स्टूडेंट्स लिए उसकी जगह अगर आप फैकल्टी लेते तो विल
हम्म।
इट बी हेल्प, इट विल बी अ हेल्पफुल फॉर द स्टूडेंट्स। आपने नर्सिंग
यस
स्टूडेंट्स को
सर।
लिया, उसकी जगह अगर आप फैकल्टी को लेते, नर्सिंग फैकल्टी, तो
ओके
आई
सर।
थिंक ये मोर इफेक्टिवनेस काफी रहता, ताकि वो बच्चों के बिहेवियर को असेस करके न बच्चे को उस
यस
तरह
सर।
से मॉडिफाइड कर सके। ओके, मैं
ओके
उस
सर।
लेवल पे जाके सोच रहा था।
ओके
तो
सर,
मेरे
मैंने
को
ये
कहीं पे
सोचा
सेट नहीं
कि
हो रहा है कि आपने नर्सिंग स्टूडेंट्स क्यों लिया
नहीं
बराबर।
सर, मैंने इसलिए लिया नर्सिंग स्टूडेंट। व्हाई? बिकॉज द नर्सिंग स्टूडेंट्स हैविंग एकेडमिक असाइनमेंट, सम एग्जामिनेशन
वो तो
प्रिपरेशन,
देखो
सम
सभी,
क्लिनिकल
कोई भी,
रिस्पॉन्सिबिलिटी,
ये सब
रेगुलर स्टडी।
देखो ये
सो
तो हम
दैट्स
लोगों
व्हाई।
ने ही ऐसे मिथ्स बना के रखे हैं कि नर्सिंग वाले स्टूडेंट्स को नर्सिंग का असाइनमेंट्स काफी रहता है, ऐसा नहीं है। एमबीबीएस वाले को भी उतना ही रहता है, बीए करते हैं
हाँ
उसको
सर।
भी इतना ही रहता है। सबका लेवल ऑफ अंडरस्टैंडिंग एंड लेवल ऑफ स्टडीज आर द सेम ओनली, इट इज डिजाइन। ये तो हमने मिथ्स
ओके
बना दिया है, हमने काफी वो कर दिया है। बट आई डोंट थिंक सो कि प्रोकास्टिंग, हम उस तरफ नहीं जाते हैं, प्रोकास्टिंग की तरफ, प्रोकास्टिनेशंस की तरफ आ जाते हैं। तो
ओके सर।
इंस्टेड ऑफ टेकिंग नर्सिंग स्टूडेंट्स नॉलेज, ओके, हम इसके प्रोक्रास्टिनेशंस ना हो उसके लिए हम फैकल्टी को इसके बारे में मीन्स बताएं, उसकी लेवल ऑफ नॉलेज असेस करें, तो आई थिंक ये सोसाइटी को ज्यादा बेनिफिट देगा। हम नॉलेज
ओके सर।
स्टूडेंट्स की असेस करेंगे उससे हमको कोई हेल्पफुल नहीं है, व्हाट
ओके
आई फील।
ओके सर।
ओके, ऑफ कोर्स ये नर्सिंग स्टूडेंट्स को कब फील होगा, यानी कि जब नर्सिंग स्टूडेंट, वो भी आप तो जीएनएम वाले कर रहे हो बराबर, वेर वी
हम्म।
आर, जब भी ये जीएनएम बच्चा पोस्ट बेसिक करेगा, पोस्ट बेसिक करने के बाद करेगा, ओके, आप ऐसा सोच रहे होंगे कि प्रोक्रास्टिनेशंस को अवॉइड करके ने डेली वर्क करा रही हूँ बराबर, पर डेली वर्क
लाइक सम
कराने के लिए भी
सर,
तो टीचर्स ही
ये
होते हैं ना।
सर वो क्या है कि जैसे जीएनएम वाला स्टूडेंट्स है तो लाइक वो आर्ट्स और कॉमर्स कॉलेज से वो ट्रांसफर होता है साइंस स्ट्रीम में। तो
हम्म
समहाउ क्या होता है सर कि स्टार्टिंग में उसको बहुत डिफिकल्टीज रहती है। तो क्या होता है कि बहुत सारे मैंने स्टूडेंट्स देखे हैं सर, मैं क्यों खुद यहाँ एडमिशन कमिटी में हूँ मेरी कॉलेज में। तो बहुत सारे स्टूडेंट देखे, जैसे 1 मंथ में स्टूडेंट एडमिशन कैंसिल कराने के लिए आ गया। क्यों? बिकॉज उसने पढ़ना चालू ही नहीं किया, लेकिन उसके थॉट ऐसे आ गए कि वो नहीं पढ़ सकता है, उसको नहीं आता है। तो प्रोकास्टिनेशन में सर ऐसा ही नहीं है, उसके अंदर बहुत सारे मॉड्यूल्स मैंने रखे, उसमें ऐसा है कि अपन टास्क को जो है वो ब्रेक डाउन कर सकते हैं। जैसे उनको एक चैप्टर है तो इकट्ठा एक चैप्टर ना देके, ऐसे जितने भी वीक स्टूडेंट्स है ऐसे उसको हम इकट्ठा फन चैप्टर ना देके एक टॉपिक दे सकते हैं, उस टॉपिक पे वो ब्रीफली थोड़ा अंडरस्टैंड कर सकता है। तो इजीली उसको थोड़ा उसका मोटिवेशन, उसका कंसंट्रेशन उसका ज्यादा होगा सर, मेरे उस पर्पज से वो नर्सिंग स्टूडेंट्स लिए।
ओके, लेट इट बी, नो इशू।
थैंक यू सर।
थैंक यू।
Okay.
नेक्स्ट।
How many more we have, Sonal ma'am?
Ma'am, 3 is there.
So can we finish it by 1:15 or? So what should we do? Shall we take all three
Yes,
right
we can
now?
finish it as well. We can finish it.
Oh, okay.
Okay,
So
so I
let us
request,
make it little quick, so that you just discuss your statement, go to the methodology and your findings, please.
okay, ma'am, okay. Okay, next is Miss Meghna Rathod. Over to you, ma'am. Miss Meghna Rathod.
Thank you, ma'am. Good afternoon, everyone. Good afternoon, sir. Good afternoon, ma'am. I am Miss Meghna Rathod, PhD scholar, Vidyadeep University, KIM. My problem statement, a study to assess the effectiveness of plant teaching program on knowledge regarding the health hazards of mobile phone usage and its prevention among the adolescent school children of the Kumari H.G. Patel Vidyalaya Vihar, Surat, Gujarat. So these are my objective. First, to assess the socio-demographic variable of the study, to assess the knowledge of adolescent school children regarding the health hazards of mobile phone usage and its prevention, to assess the effectiveness of plant teaching program regarding health hazards of mobile phone usage and its prevention, to find out the association between the knowledge score and with their selected socio-demographic variable. So here the research methodology, I use the research approach, that is quantitative research approach. Research design, that is the pre-experimental research design. So two variables are the independent variable is the plant teaching program, and the dependent variable is the knowledge regarding the health hazards of mobile phone usage and prevention. Research setting, that is the Kumari H.G. Patel Vidyalaya Vihar, Surat, Gujarat. Research population, so adolescent students aged between the 13 to 19. Sample is the adolescents in the age group, that is the 13 to 19 years. Total sample size is 60. Sampling technique is a non-probabilistic convenience sampling technique. So criteria, so inclusion criteria, adolescent school students in the age group, that is 13 to 19 years, those who are willing to participate in the study and at the time of the data collections, those who are regular to the school. Inclusion criteria, those who are absent at the time of the data collection. Now here, so in the mean pretest mean, so that is 8.78, median is the 9, mode is 7, standard deviation, that is the 1.76, and the range, that is the 8 for the pre-test. Now post-test, so that is mean is 21.5, median is the 23, mode is 23, standard deviation, so that is 5.73, range is 25. Now difference, so that is in the mean, that is 12.27, median is the 14, mode is the 16, and the standard deviation is 3.97, and the range is 17. Same only, ma'am. That is the
Next,
graphic.
please.
Yeah. So there's the pre-test and the post-test knowledge score. So total, I divided the 3 categories. So that is poor, average, and the good. So in the poor category, so there will the poor in the 0 to 8. In the frequency, that is for the pre-test, that is 27, and the person is the 45. In the post-test, that is frequency is the 6, percentage is a 10. Now in the average score, so that is 9 to 22. So pre-test in the frequency is the 33, percentage is the 55, and for the post-test average score, that is the frequency 18, and the percentage is 30. Now in the good, that is more than 22. So that is pre-test, that is frequency, that is 00, percentage also 00, and the post-test, that is 36 frequency, and the percentage, that is the 60. That is same only graphical representation. Okay, now so that is effectiveness of the plant teaching program. So now knowledge score for the pre-test, that is 8 in the mean 8.78, mean difference, that is 12.7. Then the in the pre-test, that is mean is 8.78, and the post-test, that is 21.5. The difference, that is the 12.27. Standard deviation, that is 1.26 for the pre-test, and the post-test, that is 5.73. Standard deviation difference, that is the 97, and the same, that is the 0.29, and for the paired t-test, that is score is the 15.32, and the table value, that is 2, and the degree of freedom, that is the 59. Now that is outcome, that is the result of the study will be proved that the plant teaching program is an effective way to improve the knowledge regarding the health hazards of mobile phone usage and its preventions among the adolescents. So these are the references are there. Yes, sir. Thank you.
Okay, no issue. Thank you.
Just one thing in Meghna, just take your
Yes.
objective slide.
Yes, ma'am.
So basically, when you're writing the objectives, the second objective exhibits as if you have written it for a survey type of study.
Okay.
So you need to write, you need to put it in this way to assess the pre-test and post-test level of knowledge of samples before and after administration of, is it, I think PTP, right?
Yes.
So that is just
Yes,
one
plant
suggestion
teaching
from my
program.
end. Yeah, so your third objective is okay, but when you're writing the second objective, definitely you have to mention your pre and post test as well
Okay,
as
ma'am.
your both the thing,
Yes, ma'am.
intervention as well. And even certain times
Yes.
we hypothesis अभी हमने इसमें discuss नहीं किया, but certain times level of significance भी हम mention करते हैं, if not mentioned in hypothesis. Okay?
Yes, ma'am. Okay. Yes.
Yeah. Okay. And one thing, it is one school, right? You said.
Yes, ma'am. One school.
एक ही school है आपका setting में, and number of
Yes.
students are 60.
60. Yes.
Okay, ठीक है. Thank you.
Thank you, ma'am. Yes.
We
Thank
can
you,
go to the
Miss.
next participant.
Yes, ma'am. Our next presenter is Miss Khushbu Patel from Vatsalya Nursing College, Surat.
Yes, good afternoon, respected chairperson, judge, dignitaries, faculty members, and all the delegates. I am Khushbu Patel from the Namo Nursing College, Silvassa, and I am presenting my research paper. Title is a study to evaluate the effectiveness of the structured teaching program on the knowledge and attitude regarding the professional etiquette among the nursing student in the selected nursing college of the Dadra and Nagar Haveli. So this, yes, in my research introduction, there is a central idea. Nursing is not only about the knowledge and clinical skill, communication, compassion, and the respectful professional behavior are the equally important in all those things.
Khushbu, kindly stick to the objectives, please.
Okay, ma'am. Objective is to assess the pre and post test level of knowledge regarding the professional etiquettes among the nursing student in the selected nursing college of the Dadra and Nagar Haveli. Second objective is to assess the pre and post attitude regarding the professional etiquettes among the nursing student in the selected nursing college of the Dadra and Nagar Haveli. And the third objective is to administer the structured teaching program on the professional etiquettes among the nursing student in the selected nursing college of the Dadra and Nagar Haveli. Fourth is the evaluate the effectiveness of the structured teaching program by comparing the pre-test and post-test knowledge and attitude score regarding the professional etiquettes among the nursing students. And fifth is to determine the association between the pre-knowledge and attitude regarding the scores regarding the professional etiquettes and the selected socio-demographic variables among the nursing students. Yes, this is the hypothesis. Yes, methodology. Research approach, I used quantitative approach. Research design in one group, pre-test, post-test design. Research variable in that independent variable is structured teaching program on the professional etiquettes. Dependent variable is the knowledge and attitude regarding the professional etiquettes. Research setting is a Namo College of Nursing, Silvassa. Sample is a first year BSc nursing students. Sample size is the 68 students. Sampling technique is a non-probability convenience sampling techniques. Then inclusive criteria. First year BSc nursing student present willing to participate in my study. Exclusive criteria is the prior formal training, unwilling and absenteeism, long-term leaves. These students are excluded. Tools is demographic performer, knowledge questionnaire plus attitude scale. Knowledge questionnaire I had added 30 MCQs, 1 mark each correct answer. Attitude scale 5-point Likert scale. Pretest is knowledge and attitude scale both are assessing. Then intervention structure teaching program. Post test is after 1 week we assess the post test knowledge and attitude score. Then teaching methods, lecture, discussion, role play, and audiovisual aids. I used knowledge score divided according to adequate, moderate, and inadequate according to attitude score, positive, neutral, and negative. Content validity by the 9 experts. Knowledge reliability is a split half method and it's becoming a 0.7 percentage. Attitude reliability is a test and retest method is 0.8. A descriptive statistic, I used data analysis in the frequency, mean and mean percentage and standard deviation. Effective
Next.
okay. In result, I used the 8 part of the categorization in the first pre-test knowledge score. In a pre-test
You
inadequate.
have a combined table,
Yes,
Khushbu,
yes,
showing
I
pre and post
complete
together. You can open that.
also is there, ma'am. Actually, domain wise, I also categorization, ma'am.
Okay.
And okay,
Combined, like showing pre-test and post-test together and the variables.
graph is present in
So
next slide.
present the graph then in that way.
Okay, ma'am. Yes.
Yeah, best.
Of the pre and post test knowledge score, there is a vast difference between inadequate, moderate, and adequate knowledge. There is a pre test having a 67.6%, and after intervention, moderate knowledge is included in the 67.6 percentage, and adequate having a 20.6 percentage. Knowledge score is improving. The next slide. Yes, there is the effectiveness of the structure teaching program, pre-test and post-test. Mean difference is a means is a 15, pre-test, standard deviation is 6.95, post-test is a 24.90, and standard deviation 4.57. Mean difference is a 9.90, degree of freedom is 67. Parity test used in 9.0, p-value is a less than 0.05, so it is the inference is a significance. And comparison of the pre-test and post-test attitude score. Majority of part pre-test is a neutral attitude, having a student like a 79.4%, and after the intervention, they are changed the attitude like 92.6%, because they are positively taking the all those things. Effectiveness of
You can move to the next slide.
yes, this is a
What are the
association.
variables, causes, correlation or association?
Sorry, ma'am.
No, you can just discuss this in short, variables.
Yes, there are the association pre-test knowledge score with the socio-demographic age, medium, previous training exposure, place of the residence, type of family, and workshop, either seminar participation are the significance at the less than 0.05 level, and other demographic variables like type of family and some single variables are non-significant in my study. Attitude are the not changed because there are almost of are having a neutral attitude, so that's why these things are the non-significant. In discussion, the study findings shows okay. In implication.
Come to the last slide.
You can skip.
Okay, reference.
Khushbu, your samples are with students.
First year BSc students, ma'am.
So come back, just take this correlation slide, association wala जो slide है या correlation, what have you assessed? You have added a few things related to medium. So what is which nursing, BSc nursing is taken out in regional language, is carried out in regional language?
It means, ma'am, Gujarati or Hindi, so that's why.
No, what do you mean? It is language that they prefer or medium of instruction?
It
Medium
was
of,
a BSc nursing, no, it was only.
yes,
Yeah, it
ma'am.
was
To
only
take
BSc nursing. Then
Only BSc nursing.
the data
first
should
year
not be like
students. Then how?
this.
Yeah. How can you say
See,
that the BSc nursing course happen in regional language also?
Not, ma'am, regional language. It's instruction they may given like in which language, so that's
No, that is
you
that is
can
incorrect.
you cannot bifurcate the instructions also.
Hmm.
Ma'am,
Second, you have taken nurse. Your
medium of instruction is there is in English or regional mean regional. There mainly there are two languages in Hindi and Gujarati, so that's why, ma'am.
no, but when you put it on paper as research paper, you cannot show that medium of instruction has an another option other than English.
Okay, ma'am.
Language of teaching, you can put it in that way. Okay.
Okay, ma'am.
And secondly, I want to just ask, your topic is professional etiquettes, right?
Yes.
So are first year students not taught about professional etiquettes in their first semester itself?
Ma'am, they are learning, but they have some doubts and some gap between the actually theory and clinical portion. So I have demonstration that communication gap between how to deal with the patient also, even though there are the some role confusion also is there, like how to build the trust with the patient and
See, your topic is professional etiquettes and you have done an STP. Am I correct? Or a
yes.
plant teaching program. So basically, what was your medium of, I mean to say, आपने AV8 क्या use किया है और आपका method of teaching क्या था? Lecture कम discussion method था कि demonstration था?
नहीं मैम, लेक्चर कम डिस्कशन भी था विथ डेमोन्स्ट्रेशन विथ रोल प्ले था मैम.
आपने अकेले ये सब कुछ किया एज एन इन्वेस्टिगेटर?
Throughout the student help also, I am taking a MSc student and all those prepared by script, manuscript, like how to deal with the patient, how to communicate with the patient in different way.
No, but when you are using so many methods of supposingly your methods of teaching, you have including to teach this topic. So is it not necessary that you have to keep it as much as possible standardized? आप randomly कोई भी role play तो नहीं दिखा सकोगे.
No, ma'am.
Whenever you prepare a lesson plan or whenever you prepare a tool for data collection, the first and foremost rule is what? That it should be validated and it should be reliable.
Yes,
So
ma'am.
basically, if you say that you have used a lesson plan or you have your method of teaching is a lecture cum discussion method, then you have to make a lesson plan accordingly. If you
Yes.
use some another method, say for example, you are demonstrating a procedure, then it becomes a procedure plan,
Yes,
right?
I prepared, ma'am,
So,
lesson plan also, and I have given
so
expert
already,
all those
yeah,
things.
my question is that when
Yes.
the first year students are already taught this topic,
Mhm.
in the initial months itself, again you are selecting them only to teach them professional etiquettes.
Ma'am, actually, they are
Hmm.
having some gap regarding the how to communicate with the patient and how to behave with the patient, like in
So that
professional.
would be causing
But
manipulation of
because
your own data. See, if already they are having good amount of knowledge in the
ma'am,
first half, like initially itself before your intervention, so how can you be so sure that, say for example, आपका level of significance is या जो भी आप alpha ले रहे हो वो 0.05 है. That means 95% you are confident as an investigator or a researcher that your intervention has made a difference in the pre and post scores, right?
Yes. But ma'am,
So if already there are extraneous variables that can impact your data collection, so won't you think that you should be, मतलब वो चीज हमें mention करना चाहिए, मतलब या तो आपका टॉपिक या तो आपके सैंपल्स.
actually, ma'am, before going to the clinical, I will give that theory part they are learn little bit like ethics and all those things, and communication techniques and all those things. But how to deal with the patient, they don't know. So that's why I am doing the role play and
That is why we have introduced simulation based education in our modules, in our curriculum.
Yeah.
Understood? When we are putting a remark like this, so हमारा जो curriculum है BSc nursing का है, it is having good amount of weightage for simulation based education. उसका purpose यही है that students are not just getting equipped with theoretical knowledge, but they are also equivalently equipped with practical or simulation skills. So this is my suggestion. Thank you.
Yeah. Okay. Thank you, ma'am.
Okay, thank you.
Thank you. Thank you, Ms. Khushbu Patel. Thank you, sir and ma'am. Now our final presentation. For that, I invite Ms. Prakruti Rathod from Vatsalya Nursing College, Surat.
Good afternoon, everyone. Shall I start, ma'am? And sir,
Yes, yes.
Yes, you.
Okay, sir. My problem statement is an evaluation of risk factor identification of cardiovascular disease among adults and assess the effectiveness of structure teaching program on knowledge and practice of risk reduction among high risk group of adults in selected areas of Surat, Gujarat. Ma'am, objectives, please. As we all know that every human being is author of his own health and disease.
Please
So
skip and go to the objectives, please.
Yes, ma'am. Yes, ma'am. Objectives. First is to identify risk factor and calculate the risk of cardiovascular disease. Second, to assess the knowledge of high risk group regarding risk reduction of cardiovascular disease before and after structure teaching program. Third, to assess the practice of high risk group of adult regarding risk reduction of cardiovascular disease before and after structure teaching program. Fourth, to correlate knowledge and practice score regarding risk reduction of cardiovascular disease among high risk group of adults. And fifth, to find out the association between post-test knowledge and practice score regarding risk reduction of cardiovascular disease among high risk group of adults with selected demographic variables. Result, ma'am, can you please do the previous slide? No, result. Next one, ma'am. Yes, ma'am. Result, yes, ma'am. So here, basically, I have done, first of all, risk identification. In that, I have screened 400 adults using their WHO risk chart that is non-laboratory based, and among that who are adult are identifying as a high risk for cardiovascular disease. Among that, I have administered the structure teaching program. So here among 400, 119 people are identified as a high risk for my study. Next one, ma'am. Here is the WHO cardiovascular disease risk non-laboratory based chart. And here basically two things are required. First is BMI and second is blood pressure. Next, ma'am. So here is the socio-demographic performa of high-risk group of adults. Here I have identified that age group of 55 to 59, gender among male, religion mainly Hindu, nuclear family who are married and who are non-governmental employees are in the high-risk group of adult. then who are is having higher secondary education, who eat mixed diet, vegetarian and non-vegetarian both, who are at income of 10,000 to 15,000, and who are at first degree and second degree relative are also having a high risk. Then who are at pre-obese and obese level are majority of my participant, and who are having higher blood pressure, cholesterol and high sugar are also identified as a high risk group of adult. Then in smoking, alcohol and tobacco consumption, most high risk group of adult are daily smoker or daily taking alcohol and tobacco. Then majority of high risk group of adult are physically inactive and are having some kind of stress in their life. Then in dietary pattern or intake of oil, salt and sugar, which basic things for the diabetes, cholesterol and hypertension. So here, according to WHO and Indian Heart Association, I have defined oil intake less than 5 teaspoon, less than 6 teaspoon of sugar intake, and less than 1 teaspoon of salt intake is good for our health as a adult. But majority of participants are not taking that. And intake of fat, majority of participants are taking saturated and trans fat on daily basis, and monosaturated and polysaturated fat in lower amount. Next one, ma'am. So here the knowledge score of pre and post test. In that I have mean score is in pre-test 12.64, in post-test 18.80. So mean difference is 5.68. So here my calculated value is 16.98, which is greater than tabulated value. So knowledge is improved after my structure teaching program. Second one, ma'am. And for my practice, I have taken the time series design in my second phase for practice assessment. And for that, I have used inventory checklist, as the lifestyle practices I cannot directly observe. So for that, I have analyzed using two-way ANOVA. In that, here the F tabulated value is 1.69, which is greater than critical value 1.28 within the group, and also between the group 73.03, it is greater than critical value 2.63. So here I can also clarify that the within a time the practice score is changed. Next one, ma'am. This one is the correlation between the post-test knowledge and practice score. Here the Karl Pearson's correlation coefficient I have used, and the mean score is 18.07 versus 15.32, and the correlation is 0.142, which is moderately positive. So we can say that knowledge and practice are interrelated to each other. Then in association, certain demographic variable like age, education, history of cardiovascular disease in family, high cholesterol, trans fat intake, physical inactivity, polyunsaturated fat intake, which is associated with post-test knowledge score, and marital status, occupation, monthly income, trans fat intake, physical activity is significantly associated with post-test practice score. Next one, ma'am. Ma'am, can you
So
go
you
to
can
the next slide?
skip.
I request evaluators.
Thank you, ma'am and sir.
Thank you.
Hello?
Yes, ma'am.
Yeah, Prakruti, can you take me to your problem statement slide?
Yes, ma'am.
So, what is exactly your research design here?
Ma'am, for first To identify the high risk group of adult, I have select the survey design, and then after
okay.
that in experimental design, I have select the time series.
So did you present your data related to structured teaching program? Effectiveness of structured teaching program आपने present किया है?
Ma'am, content.
Yeah.
In that, I have included cardiovascular disease definition, some cause and risk
No,
factor.
no, I mean to say, I'm sorry, I may have missed it also, but I'm just asking. I did go through your entire evaluation survey that you have done, but the next second part of your problem statement is effectiveness. So ये structured teaching program आपने उनको ही दिया जो आपके सर्वे के हिसाब से हाई रिस्क में थे?
Yes, ma'am. उनको
The
ही
same
दिया जो हाई
samples?
रिस्क में था.
The
Yes,
same
ma'am. Same, same.
samples?
Yes, ma'am.
Okay, so that means just explain me your process of data collection. So आप अगर गए हो pre-test मतलब you have gone there, you did a survey, you identified that the BMI is beyond optimal level. Plus, what is the next thing that was mainly significant risk factor में? BMI था और सबसे ज्यादा commonest risk factor क्या था सबसे ज्यादा samples में?
Ma'am, I have identified high risk group of adult using WHO risk prediction
Okay,
chart.
so
Or
which two criterias were common in most of the samples of yours?
blood pressure majorly, and second one is BMI.
Exactly. So blood pressure and BMI. So how you did? You identified that, okay, say for example, how did you come across blood pressure? How did you select, decide that the sample is having risk of blood pressure issue?
Ma'am, I have measured the blood pressure, but I did not diagnose them as a hypertensive patient or pre-hypertensive
Okay,
patient. Here, the
done. So
risk
that
prediction
became your
chart
sample.
require. Yes, ma'am. So in that, I have taken the value of blood pressure and BMI, and then according to chart, what is value is best match for high risk group of adult. That are my samples.
Okay, understood then. Then उसके बाद आपने उनके साथ STP कैसे किया?
मैम बेसिकली ये स्टडी सूरत में हुई है, तो मैंने सूरत के पूरे एरिया को जोन्स में डिवाइड किया है, और एवरी जोन में से सिलेक्टेड सोसाइटी ने परमिशन ली है कि सेक्रेटरी या फिर कोई वॉलेंटियर हो जो मुझे स्टडी में हेल्प कर सके, और वहां पे जाके मैंने टोटल 10 डेज में डिवाइड किया उनका सुटेबल और अवेलेबल टाइम कि कब मैं आ सकती हूँ डेटा कलेक्शन के लिए.
So
Then,
your high risk individuals were 119, right? Out of 400.
yes, ma'am.
So your STP samples are also same 119 samples.
Yes, ma'am. 119.
So same 119 samples. So you give individual STP based on the after you identified the their high risk factors.
No, ma'am. Total, I have given in 7 days and different society. I have given STP. Means कि in one day morning one society or evening in one
No,
society.
it's not the society, dear. Your main thing is what? Your main thing is that the same individuals who have been identified as high, this one,
High risk group of adults.
yes, the same individuals are your samples of STP.
Yes, ma'am.
Am I correct? So you should have,
Yes,
I
ma'am.
guessed that you must have coordinated in that way
Yes, ma'am.
कि आपका वो match हो, ऐसा मैं assume कर रही हूँ.
Yes, ma'am.
Okay, yeah. Anyways, I'm happy with the type of statement and the efforts that you have put on a lot of things, that is identifying high risk adults, plus having a reference of AHA and WHO. So these are those extra efforts that you have put to just more and more validate your problem statement and your study. So I'm little glad on that part.
Thank you so much, ma'am. Here, I can also add something that with my study, I have also identified two high-risk group of two adults, which I have referred to further investigation, and they are having moderate risk of cardiovascular, मतलब coronary heart disease. So currently they are on medical treatment.
Sonal ma'am, are we done with the presentations?
Yes, ma'am. Yes, we have completed, ma'am.
And Himanshu sir, you as well. Can I take a break of at least 5-10 minutes because there is something urgent coming around?
Okay, no problem. I think we have completed, then.
We have
Sonal?
completed,
Yeah.
ma'am.
Yes,
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 So then can
okay.
we wind it up? So because I may
Okay.
have to leave the meeting, that's why.
Yes, ma'am. Yeah, just 2 minutes, ma'am. We have completed, ma'am. Okay. So thank you very much for this insightful presentation. With this, we have successfully completed all the scheduled scientific paper presentation. On behalf of Vibrant Nursing College, Surat, I sincerely congratulate all the presenters for their excellent efforts, preparation, and contribution to today's academic session. I would also like to express my heartfelt gratitude to our esteemed evaluators for their valuable time, expert observations, constructive feedback, and encouragement to the presenters. Once again, thank you so much to all the participants, ma'am and sir. Have a great day.
Thank you. Thank you, Sonal
Thank
ma'am,
you.
for being such a
Thank you.
Thank you, ma'am.
active
Thank you, sir.
coordinator.
Thank you, ma'am.
Thank you, ma'am.
Uh,
Thank you, sir.
Thank you all
all
the
of you, and
participants
wish
as
you all
well.
the best to
You did a
everyone.
good job.
Thank you all, ma'am. Thank you. Thank you, sir.
Thank you so much.
We shall leave, no?
Yes, sir.
Sonal,
Yes.